Yeah, good afternoon. The inter between digital media use and development. A very fascinating topic. It talks about how I'll be talking about various aspects that how, as the digital media use is increasing, how it is impacting the development, social, emotional, cognitive, language, and at the biological level. And we all already heard about the guidelines, but let's see, can we put it into practice? That's the golden, most important thing. We know that children today are digital natives. These are some of the new words which has come up. And I'm also trying to increase my vocabulary as more and more new words are coming up. And we also know that childhood is a period of enormous brain plasticity. Exposure has an impact on their developmental stage, can have long-term health outcomes. And so here, the right interplay, as we heard from the previous speakers also, we heard from the minister also, we can't run away from the technology. The 5G is already there, 6G is on the way. We are talking about digital health few days back at Delhi. We're talking about digital health. G20 summit is there in Delhi on 9th, 10th. So digital health is coming in a big way. We can't run from away from that. So the important thing is that how can we have the right cocktail or mocktail for this digital world and the child development? And that's where we mental health professionals, policy makers, administrators has to come into, involving the teachers, one of the things which was asked. And we know that these are some of the figures, we all know, and the only punchline of these all the figures is that everything is on the rise, nothing is on the down. Whether it's I really like this. My colleague Dr. Navonita Sen Gupta, who is with me as a child psychiatrist, she worked hard with me for this presentation. This slide, that 4 years in 1970, that was a time when you used to start getting exposure to almost now to 4 months in the present day. You see how much it has come down, and it's going up. Like almost all 0 to 4-year-old have used a mobile device, and mostly for entertainment. So it's more difficult, and also it's more difficult to monitor in terms of what the child is playing or downloading, and where and when they're using, because that's what mobile is. You can't have all the CCTVs, you can't have the 24/7 supervision. It's easy said and done. Supervise your child, be after them, keep a watch. It's easy said and done. Being a father of 2 young daughters, now they're in college, and one of them is working. I've gone through that. I've seen that. And after giving lectures and lectures for enormous platforms in schools, it's easy to preach. And these, we all know, these are again one of the figures, but what I wanted to emphasize is this last point about one of the figures which came, that how with COVID pandemic, the hours have gone up. The 8 to 12-year-old, which are called tweens, spend an average 5.5 hours a day on screen. And for teens, 8.5 hours a day for teens. So this all shows that exposure is there. And one of the again article which came up, which shows that how the percentage is going up. And what I want to point out in this, and I'm sure Dr. Manoj will have more data about it, that around more than 50%, they are ready to turn on their location services for some or other of their social media accounts. They're okay. And they are okay to post their name of the school. They're okay to post their full date of birth. They're okay to post their phone numbers. And 77% are ready to post their photos also. They don't have any hesitancy. They want to be visible. They want to have that dopamine rush, which Dr. Benegal was talking about. That kick is that. And cyberbullying is in the air. That's what the figure says. And the thing is that 2/3, around 69%, have witnessed bullying, but only 1/3 reported. And the parents of the city, they have never attempted to find out what their child's online activity, a lot of times. So what I want to highlight this slide is that a lot of times, almost 40% of the parents, that for them, it's too time consuming to monitor the use. They say we are busy. We don't have that time. And around 20%, They say they're unable to find the information needed to set up parental controls. They're not digitally what they call they're educated. They don't have that knowledge how to do it, and they one third feel that children are too smart to find ways to get around the parental controls. So these are all the various perspectives. But what I want to emphasize now with this, the second part of my presentation, are the newer digital media educational affordances and limitations. Coming to the cognitive development, children younger than 2 years is still in the Piaget's sensory motor stage of development. They can imitate, they can recall actions performed by a person on a screen or imitate sign languages from videos, but they cannot learn the new language without a real life adult helping them learn. That is where the human beings are different. That's where children need the human contact, human touch. At this age, attention controls and symbolic thinking are too immature for children to be able to transfer the knowledge from screen to three-dimensional life. They can see, they can witness, but they can't replicate it to their real life. And the interactivity of screen is limited compared with teaching from adults who are able to read and respond contingently to the knowledge, behavior, and affective states. So even the most tailored educational apps and games do not have this complex capacity. In the end, the screens can't replace human beings. That's the gist. Coming to higher order thinking and executive functioning, experts in the field have warned that children may not generalize such digital skills to their everyday environments, or that the closed loop of the app based learning teaches less critical thinking. That they don't get the critical thinking. Coming to the language development, children younger than 2.5 years, though the guidelines have changed, what you saw on the screen, how much is too much, the guidelines have changed. I'll come to that lately. But children younger than 2.5 years cannot learn novel words from videos without parents co-viewing. That's why parents co-viewing is very, very important. Somebody was asking that question, that what should be said. And using the same words in everyday interaction. By preschool age, well-designed interactive educational digital media can teach children language and literacy skills, but co-viewing is very, very important. The way there is boom, the way the things are exponentially growing in technology world, the more and more apps are coming daily a day, it cannot replace. Studies have shown that children learn content, knowledge, vocabulary equally from digital books and parent books. See the difference. So they can learn from digital books also and print books. But what is different is that when reading the digital books, parents use fewer dialogic reading strategy, such as labeling objects, asking open-ended questions, and commenting on the stories beyond the actual pictures. But they most comment on digital device. Tap that, push that, change that, look that. That's what. So that is a different. So it is important that that shared parent-child experience is not to be replaced with digital learning. And that is what is impacting. That is why we saw a lot of virtual autism, pseudo autism, not to be the true autism thing in this, the COVID thing, what happened with us. So that's their thing. Socio-emotional development, again, play is central. We know that to the child's socio-emotional development because it provides a special opportunity for affective exchanges. That affective exchanges and social reciprocity, these are two important perspectives between the parents and children. However, the background TV, the background media distract from parent-child interaction and negatively influences a child's socio-emotional development. Certain forms of digital play may be effective at bringing a parent to child, like clicking a photo or uploading and all those things, but they can't. And some of the apps have been developed to promote social emotional skills. In fact, they have been used in neurodevelopment disorders, but none have been formally tested. So in summing up, for the infants and toddlers, 24 to 30 months, the primary way children learn from digital media is through caregiving, co-viewing, is through caregivers, co-viewing, teaching them about the content and repeating this teaching through daily interactions. That's what is there. Thus, any digital media product that does not try to involve the caregiver is unlikely to be educational at these young ages. So what is very clear is that the parents and the caregivers have to be involved. And that's where they've little bit modified the new guidelines, which you will see, depending on these findings, what has come up. For the preschoolers and school-age children, the well-designed educational apps based on established curriculum can be educational, no doubt about it. But most of the commercially available apps marketed as educational have no evidence to back up this claim. They're coming up, they're promoting it in a big way, but there's lack of evidence. What is there? So And review of the most popular educational apps showed that most have no input from developmental scientists and are not based on curriculum and target only simple skills. Thus, the app designs that includes fear distracting features so that children can truly engage with learning content, designed for a dual audience, both parents and children, and features that allow the child to transfer their knowledge to the physical and the social world around them can only be beneficial. We all know that prolonged exposure to screens can limit opportunity for hands-on exploration and real-world interaction, which are crucial for brain development. We all know that. What is we saw in this COVID, and what we saw happening was that the constant absorption of digital media affecting their focus and attention. We saw a lot of children who were just having few ADHD features, but after the COVID, we saw a lot of them having more ADHD features. We saw they were more distractible, more inattentive. As Dr. Benigal was saying, it is not the issue of attention, it is sustaining attention. That is a challenge. What happened was that as children became more and more accustomed to rapid stimuli, and we know that that's what happens in this gaming and other thing. So as they became more accustomed to the rapid stimuli and frequent shift in the content, it didn't give them enough time to process the words, voices, and images. That is where the thing happens. So you're not able to mull over, you're not able to process those words, voices, and images. When you're having it's rapid. That's why you're playing constantly gaming. You're constantly changing. You just click, 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 click. That's what is happening up. One message stuck, one is stuck, one is stuck. That's what happening. Whether you're chatting, whether you're playing game. That's where thing comes. It also impedes the development of executive functions like impulse control if screens are used without the structure or boundaries, working memory, problem solving, and planning. The constant switching between the stimuli, that's where the books become boring. And that's where the games and the technology becomes very, 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 rapidly as it coming to them. It can make it harder to focus on the task that requires sustained concentration. So over-reliance on the screens can hinder the language development by reducing the face-to-face communication and limiting exposure to reach the language environment, hindering vocabulary and comprehensive and excessive language skills. That's what we, again, as I was talking about, we saw a lot of cases of virtual autism. Children often imitate what they see on screens. Very true. What they see, it's almost like a social learning. And visual intake is the fastest way of learning, and which can reinforce passive consumption rather than active learning and critical thinking. That's what, again, is happening. The active learn critical thinking is getting compromised. And that is where concerns a lot of educationists and developmental reformists. Now, this is, again, as from working with children, is that screen exposure inhibits young children's ability to read faces and learn essential social skills, which are the two key factors: to read faces and learn essential social skills. Again, that is what something we see in neurodevelopmental disorders. The face-to-face interactions are the only way young children learn to understand non-verbal cues and interpret them. And when their exposure was stopped, and then when stimulation was given, and parents were told that this is impacting their development, then again, a lot of the kids who were suspecting as a virtual autism, pseudo-autism, developmental issues, they start blossoming up. We saw that they start coming up. Also, the sleep. The blue light emitted by screens can interfere with the production of melatonin. We know that, a hormone that regulates sleep, potentially leading to the sleep disturbances. The violent media content and children aggressive behaviors have been well documented. We have enough papers on that, due to children imitating on-screen behavior and arousal responses to frightening content. Engaging in the digital world excessively from an early age, which Dr. Benigal was emphasizing again and again, might increase the risk for developing unhealthy screen-related behaviors and other addictions. Heavy media use during preschool and school-aged years is associated with obesity, headaches, backaches, blurred visions, carpal tunnel syndrome, and postural problems. We all know that. So you see how they can impact the development. Multiple aspects. And now we have enough studies. So I've just highlighted some of them. I'm sure there are more and more studies are there, that how the growing body of evidence has found that childhood and the teen brains can be structurally changed by spending long spans of time on digital media. One of the studies which came in November 22, 2022 by Hutton et al. The MRI scans of 52 children, 3 to 5 years, how the higher media use was associated with accelerated maturation in certain basic areas, like visual processing. But underdevelopment, you see, so some areas got accelerated maturation and some areas getting the development. In other higher order areas that support the language development, reading skills, and social skills. So one is there, how is it compensating? So one is overcompensating and one is undercompensating. That's what is happening. And one of the big study which is happening, the ABCD, the adolescent brain cognitive development study, which clearly says that higher digital media use and the lower cortical thickness. So the more and more digital media use is associated with the lower cortical thickness in areas involved with visual processing, executive functioning, memories, and attention, higher level of behavioral problems. Also, this is something which really hit me, that how the functional connectivity and the white matter integrity, and that is what between the brain network supporting language and the imagery was strongest and most balanced during an illustrated storybook format compared to the animated version of the similar stories. So when it is more of animated versus the illustrated storybook thing, how the net connectivity was different. So this is what the functional imaging is coming up with. So the consistency is that of these brain findings involving young children and the teens, there is almost like a spectrum, that there's a cumulative impact. It's not that it's that just at 2 years stops. 2 years, 4 years, 6 years, 8 years, 12 years. So there is a cumulative impact of the digital media use, which tends to increase with age and impacting your brain. That's what, as we go into adolescence, the plasticity and the pruning, all is getting impacted. So thus limiting screens time and encouraging healthy alternative is something we need to look into it. We all know these are all the benefits, the good things. It's not that we can only say the bad things. We know that how the technology is helpful. New ideas, informations, current events, community participations, immediate dissemination of information, assignments, project. We are well connected during the COVID time otherwise, and valuable networks, promoting wellness, consultations, everything. There's so many good things, but simultaneously, we have to be responsible. This is what Dr. Benigal was talking about. So 2022, American Academy of Pediatrics came with the new guidelines, the post-COVID. So the long time, no screen time before the age of 2 years, the rule is out. So the latest recommendation of American Academy of Pediatrics, that 18 months or younger, no screens are still the best. They're not there. See how it has become more diplomatic answer, this thing. The exception is live video chat with family and the friends. 18 months to 2 years, limit the screen time and avoid solo use. Choose high quality educational programming and watch with kids to ensure understanding. 2 to 5 years, limit the screen time to an hour a day. Parents should watch as well as to ensure understanding and application to their world. 6 or old, place consistent limits on the time spent and types of media. Don't let screen time affect sleep, exercise, or other behaviors. So everything has been reframed. Everything has been reframed in a way. It's your choice. You take a call. And these are just the extension of those things. How can you minimize screen time? That follow the guidelines, ensure that sedentary screen time is not a routine part, maintain daily screen-free times, avoid screen for at least 1 hour before bedtime. Mitigate the risk. Be present and engage when screens are used. Whenever possible, co-view the children. Be aware of content and prioritize educational age-appropriate interactive program. Use parenting strategies that teach self-regulation, calming, and limit setting. Be mindful about the use of screen time. Conduct a self-assessment of current screen habits. Remember, too much screen time means lost opportunity for teaching and learning. Be reassured that there is no evidence to support introducing technology at an early age. So all these are extension of those guidelines. And the most important is model healthy screen use. So when anybody asks me, is that I first say, bring a change in yourself. The parents need to change before we start changing the children. Choose healthy alternatives, reading outdoor plays, creative hands-on activities. Devices at home during family time should be turned off. Turn off screens when not in use and avoid background. Good guidelines. Very good to preach, to practice stuff. So take home points. Average time spent in digital media is alarmingly increasing in children and adolescents. No second thought. No second thought. Excessive screen time has been shown to have a detrimental effect on a child's cognitive, social, and language function as well as their physical health. Too much use of digital media has been associated with structural changes, and more studies are coming up in certain brain areas related to visual processing, language development, and social skills, which tends to persist in adolescence. So there's a cumulative effect which is happening. That's what. It is important to be cautious, but not over pathologize media use, because we know that technology is really helpful to us. Because digital media enables social connections, allows self-soothing in some children, and fills the need for stimulation and self-expression. So my last point is finding a balanced approach. Finding a balanced approach that includes a combination of a quality content, parental guidance, and offline activities is crucial for healthy child development in the digital age. What I strongly believe, and there are a lot of papers which I recently also, I heard Dr. Manoj's paper which came up recently about the parental thing, which I'm sure he will be highlighting that how can we have a good parental guidance, and offline activity. These two things which I learned from my own daughters is that offline activities really works very well. But then you as parents have to take out time, and time never stops for anyone. That's what. Thank you very much. I really like this slide, which I want to show. I hope you all must have seen this slide. Let me help you to cross the road. I'm sure everyone would have seen this slide multiple times. Thank you very much. And thank you, Dr. Praveen, for giving me this opportunity. And I can only say this topic will evolve and will grow and grow. And we need to intervene wherever we can. Thank you very much.
Thank you, sir. So due to time constraints, we'll have to restrict the questions. One or one.
No.
Yes.
Yeah,
Hello.
I'll send you.
It's a as usual. It's Gupta presents like his very lively and comprehensive presentation. So after that, we can have some one or two questions only. So can we can you have a question from the audience? Yes. Go ahead, please.
Actually, the practical thing is how to start. It is very difficult because patient means when the child comes with lot of problems, and ultimately it's happened that almost they are about to leave their studies. So how to start with? That is the very beginning. Means how we can approach.
See, I'm sure Dr. Manoj will share a vast experience of a decade of a shut clinic thing and this thing. And but what I always say, just start, correct? And never be in a hurry to diagnose, never be in a hurry to label. Do your comprehensive assessment, do your homework, understand the young person. That's the second golden rule. Build a rapport, as Dr. Bedinger was saying. Once you build a good rapport, he will start understanding you. And avoid all these, you don't have to be a second parent. So a lot of time when parents ask me, can you tell to my child to study and stop? I say, I don't want to be the second parent. I'm here as a clinician and therapist. You want me to work with a child, adolescent, I'll work with it. But I can't speak your language. Very clear, very clear. So you have to build a rapport, work slowly. You don't have any magic solution for it. You can't change it. The only thing you can cut it that you can throw the mobile, you can cut the cable wires, you can disconnect the Wi-Fi. That's the only solution you have. If you have that courage, cold turkey method. Some parents have done it. It works for some of the families. If you can do that, you have that much courage. And if you're not bothered that my adolescent will become aggressive and start throwing things, break the glasses, bang the doors. And if you have that much strength, cut the wires, remove the Wi-Fi. But then you also have to be without the Wi-Fi. You have to eat the food without the Wi-Fi. You have to sleep without watching the WhatsApp. If you can do that cold turkey, all the best. I'm sorry, I've taken through the spectrum. That is a continuum after working with so many adolescents. Adolescents teach you the solutions. That's what is one of the, I'm sure that's what they will teach you. They teaches you slowly when you work with them.
Yeah, there's a question. Hello.
Good afternoon, sir. I'm Chandrajit Saraswat from class 12 Julian Day. So for us teenagers, due to the very addictive nature of the short format content of reels or YouTube shorts, it's very hard for us to realize what's just the right amount, and when are we getting addicted. Because seeing and knowing that okay, 1 hour a day is okay, or 2 hours a day is okay, and realizing it and applying it is it's different. So how can we do that?
See, I was in one of the conferences just now in Pune, and there were 3 teenagers, and we as professionals were seeing a lot of stories and a lot of inputs. But what came out from those teenagers is that one of them said using those control on your mobiles and your phone. So using those controls, and it's one of the ways which really help this thing. And for second person, it was that when she realized, though her parents were doctors, she realized that they used to keep on preaching, keep on saying, and she was constantly says. And when she saw it's impacting her studies and her dreams, then she immediately got it. That's today is the time. I need to stop. And the third person said, for me, it was my thing which used to hit me. For her, it was a nature which used to really make her feel good. So she's starting into her a wildlife discovery and wildlife sort of expeditions and those parks and this thing, which really gave her soothness and calmness, and connect with that peer group of that particular group, which which took her away from the technology. So we need to have this various things into place. How can we do it? These things are there. So having these things in place is very, very important. For that once that the insight starts coming up, that acceptance and acknowledgement starts coming up, that okay, this is what something is impacting me, and then taking the third A, the action, is that's where you start seeing the impact. But unless you don't have that insight, that acknowledgement, that awareness, that acceptance, those A's, then you can't take the right action. So these 4 A's are the most important thing.
Any other questions? I'll just make an observation. So also in terms of physical health, I think that's also because you mentioned about, I mean, that was your topic, but also it impacts your physical health, vitamin D deficiencies, problems in your vision, headaches, and all those things. So those can also be emphasized in our sessions in terms of that, that there is not more acceptance, but there is a lot of acceptance with regards to when you mention about the physical health problems, the physical health issues which are coming up. So if a child presents with a headache, you can say that you are using a lot of media. So that might be one of the reasons you explore it and see. For an adolescent, for example, that can work. The other thing is that I was reading an interesting paper because I was doing some kind of homework before I came for the session. So I think they are now making a distinction between the so-called high-income countries vis-a-vis the LAMIC countries with regards to the impact of these things in terms of cognitive development of children. And it seems that the use in these countries, one is that 89% of children belong to these so-called LAMIC countries, and there is a distinct qualitative difference between the use of social media in LAMIC countries vis-a-vis the high-income countries. And most of the studies have emanated from the high-income countries, so we need to have more data emanating from these countries.
Actually, I also have a small observation. I feel that this in understanding this, what is too much is one difficulty the parents have. That the parents were not exposed to this internet boom, so they have not experienced what is ideal for them, and that's why they see always see some people are very lenient. Some people always see threats in it, that their children are seeing the nets. They also don't know what is more or what is less. what he has said, that what is more, how can I understand? I for sometimes feel that parents can be said that if there is a dysfunction is his normal life, then we can call it as a definitely there is dysfunction and it needs intervention. Otherwise, if the child is seeing mobiles but he getting 90% marks, uh, parents is still forcing that if he doesn't see this mobile, he will get 95%. This is, I think, sort of this thing. So dysfunction has to be identified first, then we can treat.
Thank you, sir. Thank you for the enriching session.
And
I now request Dr. Ashim Chatterjee to felicitate the speaker and the chairman. Now we move on to the third session, Clinical Considerations in Internet and Video Game Addictions, Module for Management of Internet Addictions. Now I call upon Dr. J.R. Ram and Dr. Sanjay Gar to chair the sessions. And I call upon Dr. Manoj Kumar, the speaker of the topic. Dr. J.R. Ram is well-known child and adolescent psychiatrist, currently associated with Apollo Multispeciality Hospitals, Kolkata. He has 33 years of experience in psychiatry and has worked as an expert in different cities in India. He is a founder director of Mental Health Foundation, Kolkata. And then we have with us Dr. Sanjay Gar. He is the HOD of Psychiatry Fortis Hospital, Kolkata, Secretary IAPP West Bengal State Branch. He is a honorary treasurer IPS West Bengal State Branch. And he has avid teaching, campaigning of mental health awareness through media, workshop, and social license. He running a popular internship program and annual drama fest. Get your act together for the students. We welcome you, sir. I now request Dr. Sanjay Gar to introduce our speaker, Dr. Manoj Sharma.
Yeah, I will.
Yes, sir.
Right. So yeah, I would like to welcome Dr. Sharma, and as you can see, he has been running the Shut Clinic from 2014. So without kind of going through, you can all read through this. I think we will have been waiting to hear about the solutions. We have heard about the background, the context in which it develops, some of the experiential accounts from Deepak regarding how he manages and what we think. But now it's real McCoy really who runs the only possibly clinic in India of its kind. So over to you, Dr. Sharma. Thank you.
Thank you for inviting me, because technology takes a long time. So over the time we have also learned that we have to start. So I think in the outset we want to say that as far as we are concerned about addictions constitute only. Addiction constitute only 3 to 5%, majority are in the problematic users. So if you say out of 10, you will find 1 or 2 who are addicts. You will find 7 to 9 who are just in the problematic zone. But maybe I think it is the concern about young parents, or it may be the availability of the device. Parents are too much concerned that my child is becoming addict. I think they start using that word addicts, I think, which is problematic. I think we, all of us in the mental health, avoid the word addicts. We say, if you say just you are a problematic user or you have a maladaptive use of technology, then it makes different sense. But if you start saying addict, because child is also in a growing up age, because when we deal with the child, it is 17, 18-year-old child when he comes for seeking treatment. He is in the stage where he is looking for identity. He is looking for meaning in his life. And suddenly, if the parent starts saying that you are addicts, it decreases self-esteem. When it decreases self-esteem, what is left with him? It's only left with the mobile only, because he move forward. He just withdraw himself from the family context. He withdraw himself from the other affairs also. And sometimes child feel that since I am not getting good grades in academics, does it mean that I am not a good child? Because for the child, parents, it means marks should be there. If I am not done certain things very good, if I'm not good in sports, does it also mean that I have to be pressurized to play XYZ sports? So then what happens? This is all cultural changes which we are experiencing. When these cultural changes experiences, it moves the child toward real life to the virtual life. And the virtual life, what did he gets? He gets a lot of acknowledgement. Because you might have seen, if you send one Instagram message, you would get reply immediately. And all of us have a tendency, if we don't get a reply in a minute, we as an adult also become tensed. That why somebody has not seen our message. And we send one more message. And until unless that get 2 clicks in the things, we get stressed out. So their acknowledgement is significant. Affiliation, we are not getting that talk, that communication, which is, I think, previous my speakers have talked about communication in family. How many families are spending time together? In one family, when we gave the task, whether just a simple task, why don't you spend half an hour together? The whole family was very much motivated. But when they came back to us after a week follow-up, they said, we saved one half an hour, but we don't know what to do in this one half an hour. Again, we went back to the technology, because that platform, the non-verbal cues, the strategies to remain together, we are losing out. So what happened? It's create that feeling of isolation. And that's why the child is into the games, because he feels there I can talk, I can do anything. So that's another reasons for him. And the last is the overall self-esteem is growing up, because a lot of likes and other things which comes up. Because if you see, when TikTok was banned, lot of cry was there because people have lost their profession. Second was because they lost their followers. There is nothing. So I think what happened, and that's why I think though selfie is not a clinical condition till now, but still people are worried about selfie use. Though it is smartphone feature, as we are saying, responsible use. Selfie is for responsible. You take selfie when there is a occasion, because today is the occasion to take selfie. But if you are taking selfie unnecessarily, then it's a concern. And people are talking about how many selfies are at risk. Some guidelines have come, if you are taking more than 3 to 4 selfie in a day without any reason, then it's a concern. Then it may be there is some underlying meaning of body dysmorphic disorder, or there may be cluster C or cluster B, anything could be there. So it means you have to be very conscious. Then another thing which is coming up is changing your status psychopathology. So that's same thing. I may not be having solution for all the problems, because so many pictures are, so many variables are coming up. Status psychopathology also, like young people, adolescents, they change their status quite frequently. And when they change the status is also a reflection of your mood states. Because sometimes we don't talk, we don't ventilate, because there is nobody to talk, nobody to ventilate, nobody to discuss, nobody to understand you. So what we do, we project. We send it as a status, and people will know, oh, something is bad happening with you, or something is so. And that's become a reinforcement. They're like, at least somebody knows that what I am going through. So again, what is happening? We are bringing that emotional isolation. And overall, what is coming up, which somewhere has come up in the previous talk, is social isolation. Social isolation in Japanese, if you say, it's called hikokomori, which has come in clinical condition in 90s. But now if you say the social isolation has come because of internet. Parents complain child is not
available. He doesn't want to come out. He doesn't want to come out from his room. He always remains with his room. Or he doesn't want to leave the screen. So this not leaving the screen, not coming out from the room is also the feeling where attachment comes up, where my senior colleagues has talked about trauma and attachment. Because attachment could be because of any reason, but to which devices the people develop attachment. And that's why I think there is a one phenomenon you might have heard of called nomophobia, no mobile fear. People feel very anxious. People, I think all of us have a habit of to make sure that we are carrying our mobile phone. Even if we forget purse and other thing, doesn't matter. But mobile should be there. So that is a reflection of your attachment. And attachment could be because of any issue. Sometimes attachment because there is nobody to talk, affiliation, acknowledgement, or anything else. And that's why I think somebody has said rightly, if I'm not carrying my mobile phone, it seems like my soul is at home, but body is at workplace. That is the level of attachment we have. So I think if this is the level of attachment, then a lot of things, I think then it means it may be somewhere awareness remains a milestone, but awareness can minimize the problem, but it may not find you the solution. So I think I will briefly take you to some of the analogies which we have used. So I think this clinic which we started, this is in 2014, and based on, and it got a lot of, because that time it was the demand also, and we felt that it is a forward. So when we started, I think more or less, I will talk about what we call 3R approach. We started with recreational use. It could be for sometime free time activities, sometime it could be any activity where just we feel good. Or sometimes, as madam said, it could be a part of your scrolling syndrome also. All of us suffer from scrolling syndrome. Because once the free time comes, we keep scrolling our mobile phone, and how much the scrolling takes away your time, nobody knows. And I think even if you say judiciously, we check our mobile phone 60 to 70 times minimum in a day. For some time for professional reasons, sometimes for recreational reason. If you see 60 to 70 times, and if you're devoting 2 minutes or 3 minutes every time, automatically it takes away 2 to 300 minutes from your productive life. And that's why the academic decline is happening. That's why the productivity is going down at workplace. People feel I'm not productive because they are doing multiple tasking. Though multiple tasking is an asset, but doing multiple tasking frequently, it brings burden on the brain also. That how many times I have to shift from focus task to the recreational task, and recreational task to the, and one of the, I think, study which is not large population, it says your brain takes almost 3 minutes to reach back to the same concentration level. So it means if the boy who's doing multiple tasking, who's doing video chatting, who's doing social media, who's doing academics also, so it means where is the retention? So I think, so that's mean the same way it's a professional reason. If you're doing multiple tasking, where is the productivity? So it means again it implies somewhere when you are doing focus tasks, do one task at a time. But nowadays we have a habit, even if you are watching TV, we watch with the mobile phone. We are active both the sides. So that I think all the things will. So then it brings it's a recreational use. It goes toward recurrent use, where all the problematic issues comes up. Sometime it could be a nomophobia. Sometime it could be a what we call phantom vibration syndrome. Phantom is a pseudo vibration of your mobile phone. All of us feel the phone is vibrating, but when we check, there is no vibration, nothing. So that's another thing which we have to see. And adolescents, peer pressure is very much. I think they feel something would have come, so they keep checking their mobile phone. Then comes another phenomena which makes us recurrent user is called zero inbox syndrome. Zero inbox syndrome. It's the tendency all of us have to read our message and to reply our messages. To make our tendency to make our inbox zero, that also makes us a repeated user. And all these things are require consciousness. Again, I say it's a consciousness at the individual level. Professional can talk, professional can do anything, but I think it's a consciousness at the reason. Then comes the regional responsible use of internet and gaming, and that's why I think overall, if we work on response, that's what till now we talked about psychological resilience, but nowadays the talk of digital resilience. Digital resilience covers psychological, social, family, and individual factors. So I'm talking about long-term therapy then. I'm not talking about brief interventions approach, because brief intervention can work for mild users, but when we see children with 16 years who are come with a lot of problems, then they require a lot of strategies, and all these strategies will contribute to what we call digital resilience. So I'm not saying, I would start with the positive notes, that this is not everything is bad. People have talked about whether technology is helpful. Yes, technology is helpful if it is used in a moderate amount. Moderate means, I think this is this study has a limitation because we use scale scores, and we found that people who are mild users, they have a better cognitive functions. But who will define mild use? Who will define how much is too much? It's we. Nobody can define for us. And we have to see where our productivity is getting enhanced, where our productivity is getting impaired. So if that is there, then it's a right choice. So why giving up technology is a difficult task? I thought we translated in terms of very widely used model of Maslow's. So we found out that our technology use more or less satisfy all our needs. Like if you say physiological needs now is no longer needs, people can be without food, people can be without a biological function, but people say I need internet. If internet is there, mobile is there, life can be. Children also say if parents are out of station, doesn't matter, good network should be there, I can manage. Or one parents came to us and he said my son didn't have a breakfast for the last 2 weeks. Then my next question was, it was very intriguing question, that how come child can live without breakfast. The next question is, how is it possible? Then, sir, this is possible because my child gets up by 1 p.m. because he sleeps at 4 a.m. and he gets up by, so nowhere he has a go for lunch only. So that's why I think the concept comes. So where are the access? So that's why we want to bring for your attention is there are two concepts. Till now in alcoholism we talked about binge drinking, but now we are talking about binge watching also. Binge watching is very simple till now. If you can watch 3 episodes in one sitting, and if you can use screen for more than 120 minutes in one sitting, any one of the condition, which is quite possible to fulfill. I think all of us have a cognitive rationalization also. Even though we are professionals, we say whole day I was productive, but night time, nothing wrong if I watch my show series and all. If 10 o'clock, if you say most of the show series traffic start, that burden comes up. And people rationalize whole day I was productive. The same way the rationalization happen for alcohol. I was productive whole day, nothing wrong if I enjoy 2 drinks at night time. It's a control use. Similar way, you will find 3 episodes in one sitting is not a matter of concern. I still can manage. So this cognitive rationalization, again, another factor which comes, one is from device, one from socio-cultural factor, and then comes to the cognitive factors. Then comes what is binge gaming. Now people internationally, if you say, still consensus has not come, but people say if you are watching more than 5 hours in one sitting, if you can play game, then you are suffering from binge gaming. But the client we are getting in Indian context, they play 8 to 10 hours in one sitting. 8 to 10 hours in one sitting, and you talk about physical health, they say no physical problem, I can manage. And even if, because now another question which comes up, is gaming a psychological condition or is gaming a career? Dilemma is there, because gaming is also e-sport industry. E-sports, so where we have to go into draw a line, because for sometimes it's become a trauma for the parents. When their 11 or 12-year-old child say, I don't want school, I want good laptop where I can practice and can become a good gamer. Because e-sport, as far as law concerned, it's a practice game. And you need practice to become a good e-sports player, as you need practice to become a good sportsman. And people who are antagonists of our work and all, they say, how can you say gaming is an addiction? It's a career. So again, I think that's become an ethical dilemma for us also, that where to motivate this 12-year-old child. Am I doing the right thing to take away his interest in esports, which is can be a career, or am I doing the justice by saying that you are an addict? So this is a professional crisis which we have to see. So then comes the safety needs. Safety is where child feel that if the good network is there, battery is there, charge is there, you feel better off. That somewhere the feeling of safety also get satisfied. Then comes the social needs. Child say, I have so many friends on my gaming platform, but I have very few. Sometimes even if you ask this question to the young people, they say, which kind of friend you are talking about? I have to say specifically online, offline. Then they say online many, offline very few. Then we did one study whether all social media friends can become a support system or not. Because people talk about I have 500, 600, 700, but whether all these contact can become your support, answer is no. Only first 10 to 50 people who are active on social media in interaction with you, they will be your close friend also. They will remain available for you whenever you are in a crisis, but rest of the people, they are there as long as you are active, otherwise they will not find you any useful. So again it means, again question comes, am I okay to spend so much time on social media platforms? Then comes the self-esteem. Again, otherwise the need was achievement and other things, but now people feel better in terms of likes, approvals, other things, and the last comes self-actualization. People say I have become a coordinator, I have become so many, achieved in so many esports and gaming platform. People nowadays, so another thing which comes up when you work with as somebody has asked you how to start the conversation with the child, I think what you have to do, you also have to learn all these things. Because when the child of 12 years say I have built up a YouTube video, you should not say how can he build up a YouTube video and he can run a YouTube form. You have to understand him. What is your YouTube video name? Do you have particular name? I also want to watch it. Because if you show this kind of response and in the next session if you say I watched your YouTube and I found it very good, but is it the other way also? So I think in similar way, when you're talking about games, you also have to understand all these games, so that when you interact with the child, you can understand which stage he is going through. You have to understand what is his rank in the game. You have to understand what is the accessories he get in the game, what is the reward he has, until unless you have some experience. Because until unless you discuss this experience, child only will find you comfortable that he is a person who can understand me. Otherwise he will feel you are as bad as my parents, because you are also judgmental, my parents are also judgmental, what I'm going to get here? So until unless you have a good understanding, nothing will work. So it means to help these children, whether it is addict, whether it is problematic, whether it is, you also have to understand all these phenomena. So it means when I started working, I also have to understand all these social media, all these things before I can counsel my child, because so that I can understand where is this recreational use, where is it becoming recurrent use, and where it is becoming addictive use of technology. So all these phenomena, if you would not keep in check, then I think we don't just need technology to fulfill our survival needs. We need technology to feel safety. That's why I think if you see in technology user, either it would be a phenomenon of obesity or there would be a phenomenon of anorexia. They would not eat anything. So that's why the other physical issues also comes up. And that's why I think we again applied this Maslow's theories in PUBG. And again, if you see PUBG, the main function is survival. So somewhere the survival is your physiological needs. And again, PUBG also helps you to fulfill your safety needs, because PUBG games allows you various accessories. If you start playing, you will get some accessory, something, and you will continue to play. And the last game is love and belongingness through your friends, through your competitors, other things, and the others is social and competitive. So all these things PUBG fulfill, and if PUBG is fulfilling your 5 basic needs, and the Maslow has defined this is whole your life is. So where is that? So that you can now understand how taxing and difficult it is for the children and as for professionals to work with these children, because then we have to get into their space, we have to help them to motivate, change, only then we can work further. So it means when the child comes to us, parents say his parents comes in a stage, parents are in the action stage, that do something for my child. Sometimes the question comes, his exam is down the line of 2 weeks, detoxify him. There is nothing like detoxification in gaming. It's a health, it's a habit. We have to unlearn that habit. We have to learn that control. So sometimes the child remains in denial mode. So it means if you see from the motivational stage phenomena, child is in the pre-contemplation stage, parents are in the action stage. So means child say I don't have a problem, parents say he has a lot of problem. So it means first you have to develop a rapport with the child, and you have to educate the family also, because a lot of expressed emotion, a lot of things would have come in the family, which already sometimes maintain the technology use. So it means a lot of work with the child to develop his rapport, to develop his motivation, and to help him understand. And then a lot of work with the family. Once that both of them reach the stage of somewhere that determination stage, then we works. Otherwise, and sometimes reaching the determination stage is a challenge. Sometimes child doesn't come for follow-up, so sometimes parent doesn't come for follow-up. So it means, what is other alternative? If we lose in follow-up, we have to build up online. So sometimes we keeps communicating to the child that why don't you come for treatment? How are you doing? Sometimes one simple message from a therapist makes a lot of sense. So we have to build up that channel of communication. And all children are not in treatment. That's why I think we at NIMHANS have also felt the need to develop a helpline also. We are running one helpline so that they can contact us through telephone also, so that we can help them understand. So another phenomena why technology is so much, till now I think regression is a dynamic phenomena, psychoanalysis we know, but now there is an internet regression also. When I'm talking about internet regression, like once technology is with you, device is with you, the device is related with anonymity. In this mobile phone, you can do anonymously anything. Nobody will know what you are doing. And once it provides anonymity, it provides you the freedom to explore this online world. And this freedom to explore this online world goes with the phenomena of disinhibition. It also allows you to disinhibit yourself, because all of us have a tendency to go out from this control and have life in our way. And once you go for the disinhibition, you get into this regression phenomena, internet regression. And this internet regressions predispose the children either for pornography, either for sexting or cybercrime, because internet has also affected the moral development of the child, because internet provides you the option of deletion. Even if you send something wrong message to anybody, you can suddenly delete. If somebody has read, it is his or her concern. Sometimes people feel, I don't want this kind of message, but other person say, I deleted that message. So that way the moral development, how does the moral development of child has undergone change, still is a issue for concern. We don't have evidence, but it is a concern. And this is all, that's why we felt, when with this coin we thought whether internet gives us internet regression. When I searched this literature and published this work, we found that somebody has thought on the similar line in 1995, and we published this paper in 2021. So it's mean that somewhere in 1995 in US, people have already recognized that there is a disinhibition phenomena. And that's why these pathways comes up, which people have talked about, because broadly the pathways comes is disinhibition, impulsivity, and anxious avoidant. So if you go, the similar pathways works for internet also, because it provides you opportunity for disinhibition. It gives you the impulsivity is a reason for technology use, and impulsivity also somewhere the comorbid. And last is anxious avoidant. People use internet as a method of compensatory mechanism. People say, I can feel good, relax, XYZ. So what happens, like all these things leads to what we saw, loss of control over use of technology. It's become the prioritized activities for you, and it's a continuation of use despite knowledge of consequences. So if all these three things comes up, then we say person has in the last 12 months. If that is there, then we say it's a addictive use or problematic use are coming up. So what is it's all this loss of control, prioritized activities leading to digital leisure activities, which is a because of COVID, we can say people have developed leisure activities. Instead of going out, everybody wants whether we can have leisure time with the mobile phone only. That could be one reason. Fear of missing out something, very common among children. Adults also, they feel sometimes children wants that I want mobile phone till 12 p.m. or 1 a.m. because my friends are active on mobile phone, and I don't want to become an odd man out when I go to the school next day. So that could be another reason. So that's a reason for peer pressure and socialization. Digital failure. Digital failure, another term which we publish, is called how do you feel when internet connectivity goes down? Suddenly, if Dr. Parveen brings down Wi-Fi 0 in this room, will you all be comfortable? If there is no Wi-Fi in this room for next half an hour or throughout your CME period, will you be comfortable? or suddenly if there is a net connectivity, because sometimes when children are playing games or if you are in an enjoyable activity and suddenly if your internet connectivity goes down, none of us feel comfortable, none of us feel mindful, none of us feel happy, because we feel what has happened, because it has become like frustration to us. So when this net connectivity goes down, some of the children become very aggressive towards the parents, or sometimes adults also feel that irritability. So how do you, if that is happening with you, that is also a sign of problematic and addictive use. So it means we should, and digital burnout is another thing. Digital burnout is a term which we can use on ourselves, where all professionals see if we are using technology for academic purpose, research purpose, or whether are we also addicts. Answer is no. If you don't have complaint of loss of control, then you are not addict, because loss of control is a common thing. So digital burnout is excessive use of technology, continuous use of technology. If it brings tiredness, fatigueness, and exhaustion, and all these three things takes away your interest in your focus task, and further it leads to decreased productivity. If these three things are happening, then we say digital burnout, which is a phenomena which happens among professionals also who are not addict. So it's mean, again, digital burnout is not addict, but digital burnout, how to minimize, lies in our hands only. So it means, again, I'm saying, when we talk about management, it's like a many days talks, but we will try to do justice in next 30 minutes, 20 minutes. So webinar fatigue is a manifestation of COVID time only. Webinar fatigue, Zoom fatigue, all these things were because long hours, because when you are looking at the screen, you can't move yourself, because generally when you're in a sitting position, we move our neck quite frequently, we blink quite frequently, and we remain in a comfortable position. When we are in the screen, we remain attentive, and that attentiveness and long hours of screen use contribute to webinar fatigue. Gaming burnout is again thing people say long hours of use leads to an affective states. Stress, anxiety, depression are the common reasons which we are seeing are associated with technology use. So again, it means it's required lifestyle changes, it required psychological management, it's required family management. So I think I just want to highlight, so that for your attention, what are the issues are generally we see in children's. This is one case of 15-year-old child, single child, upper middle socioeconomic status families, got access to all modern devices from the age of 9 years. Because single child, working parents, most of us have a tendency to keep everything in the home so that child remains settled. Then over-involved and permissive parents, again, parenting is an issue. Sometimes nowadays, I think we talk about authoritarian parenting and authoritative parenting, but now for technology is used, none of the parenting is effective. For each family, particular parenting has to be evolved. So I think there is no fixed answer again from a therapist side, or we don't have evidence till now. Developed preference for gaming from the age of 10 years, started playing 8 to 10 hours, got rank in gaming, other benefits leading to academic, psychosocial dysfunction, anger expressions, expression of suicidal ideation. Expression of suicidal ideation could be a manifestation of psychiatric state, or sometimes it could be a reaction to the frustration. So that we have to see child to child. History of ADHD and conduct issue is a comorbid condition. I'm not saying causal issues, but that was there in this child. History of forced rehabilitation. Child was uncooperative, but parent just brought him, like the way we brought a substance user that let him be in the rehab room. But that's not the answer, because this is the phenomenon of learning, where we have to work with the child, we have to negotiate with the child for a change, for a admission. You can't just bring the child. Family disturbance and depression in mothers and other things, and it became more worse during the COVID time. This is another issue which we are now getting, is called stock market. This is for adult phenomena. This is not, till now we have talked about gaming and all, but now stock market is also a concern, because people feel because of it's a method of getting money very easily or in a short span of time. So people invest a lot in this kind of trading and all, and because once they start investing, again it becomes fulfill the criteria of preoccupation, loss of control, and they continue investing though they know there are losses and all are there. And so till now, I think these are some of the broad case reports which we publish. And we found that these are like our qualitative understanding of this phenomena. Like we found that technology is now used even to manage obsession. People felt when I have compulsions, if I start watch YouTube videos of movies and other things, it reduces my obsessions or compulsions. WhatsApp and delusional misinterpretations. One person has found particular status and he felt that this is for me and person wants to kill me. Selfie and body dysmorphic disorder has we found relationship. Internet use and mild intellectual disability. I think children with mild intellectual disability, they generally, parents doesn't give them much time to work or don't give much responsibility. Child have a lot of free time, and if they get a access to mobile phone, again they are the so again children with mild intellectual disability also need screening for technology use. Then slow internet speed and anger expression could be one reason. Abstinence violation, in fact, this also till now it happens in substance use, but it happens in technology use also. People commit that I will maintain a control, but because of XYZ reason, again they feel I can't, this is not my cup of tea. And then they again have that guilt and they again go back to the same pattern. Cyber violence, status psychopathology, binge watching, and I think pornography is another thing which we see is a common reason, but sometimes because of lack of sex education in family context or in the school context, sometimes children get into pornography to know more about sex. Sometimes the tendency is not for getting into pornography, but to get some knowledge, because some children are very introvert, they don't talk. But nowadays 12 to 13-year-old children start discussing about pornography, start discussing about sex. But children are not, they listen, but if they're not participating and they can't discuss this thing in the family context also, so what is left with is to access the online platform. So again, it means all child who watch this kind of content may not be addicted to pornography. We have to understand the reasons. So again, it means there is required a lot of psychoeducation. Internet dating and sex addiction is another thing, because dating also is a platform where people look for short-term relationship. Now we recently got some funding also, and Government of India has asked us to explore this area to see how the internet dating can become a risk factor for violence as well as for sexual behaviors also. Again, I think this is one case-based report we found very effective. We use CBT along with the naltrexone 0.25 on a very low dose, and we found treatment for internet pornography has shown good outcome. Online health research and counter transference. Nowadays, I think because of COVID, all of us have developed the phenomena of online research. Before we consult any physician, before we consult any doctors, we search them online and then we come with the information. So nowadays, even if you are prescribing CBT, cognitive behavior therapy, child may say, I am not the good candidate for CBT, I need something else. Or why don't you use DBT and distress tolerance and all? If suddenly your patient say, why don't you use DBT for me? How would you feel? You will feel good that my patient is very informative, or do you feel awkward? I think all of us feel uncomfortable because we are taught to deliver. We are not told, trained to receive. So when this kind of things happen, it brings that counter transference. The counter transference, one is a dynamic side. Now counter transference is because of technology use. So it could be another phenomenon we have to see. I think this is another condition for research in coming years. Binge watching in geriatric population. Again, till now we have talked about adolescents and children. Geriatric population, because of empty nest syndrome, where children are not there, husband wives are there, so nothing is there. So what they do, they also start watching YouTube, they also start watching other things and all. So that's why I think even geriatric population do require a lot of psychoeducation, a lot of parents, because one family came, this issue came when we published this case report. One family came, they said, we want help for our parents. It was very interesting for me to interact with this couple. Then I asked them, why do you want help for your parents? They say that whenever we communicate with them through WhatsApp, they reply immediately. But when we told them to come on the dining table, both of them excuse, and both of them remains in their room only. So they feel that our parents are addicted to technology. So again, it means the phenomena is same. When we're talking about social isolation in young children, we are also bringing isolation in parents also. So again, geriatric population needs attention. So before I go to the intervention, this is what we did in clinic. We started in 2014. And because of WHO recognitions and other things, now initially it used to be one case in a week, but nowadays we are getting almost 14 to 20 cases. And most of the cases are brought by parents only. Very few adults we get. Adults inquiry comes only on telephone helpline, but most of the children's are children's only, and it's more for games only. But again, I would emphasize we get broadly male population only, but our research suggests, and even in the cultural experience, it's a problem of both male and female. Even we are talking about male gamers, but there is a good number of female gamers also. But which is an unrecognized area where we publish one paper from India side, which is not unrecognized. So we have to work with the females also. It's not, but only I think when we did one community survey, we found only females have a high number only for shopping addiction. Rest of the things, males have a high number. Because I think shopping may be because of cultural context and maybe because of family factors. Females have that pressure to use a social media or not online platform for shopping and all. So reasons remains free time, lack of physical activities. Nowadays, I think the physical activities has gone down. Parents are not understanding them, fear of missing out something, and digital leisure activity. These are the common reasons but there will be a number of reasons along with the psychological factors. So I think this is what the profile we get. It's a 11-year-old is the minimum age we get parents who bring the children for help. And 15 to 20 is a predominant age group. Online games, social media browsing, online relationships, pornography is the commonest reason. In this case, I want to highlight one more case. Again, I think we are open for criticism. One case came to us for help for pornography use. But when we did the clinical interview, we found that earlier he had the history of cannabis use. But subsequently, there was no other substance. But when along with the cannabis use, he got introduced to pornography also. But slowly, 10 minutes just finished. So gradually he developed his interest in pornography. And what happened, the impact of interest in pornography was so significant that his cannabis use has become zero. He became abstinent from cannabis, but he became a heavy user of pornography. So then we hypothesized, we still don't have evidence, but thought maybe the brain reward system remains the same. The pleasure concept which we talked about in substance use, now maybe the pleasure earlier he was getting through cannabis, now the same pleasure he was getting through pornography use also. So it means till now we have talked about substitutions in substance use, but now it's addictive behaviors can also become a substitute for hardcore substances also. Social isolation is quite common reason for seeking help. So I think that we just pre-contemplation stage. But only challenge which remain is to keep people or children in the treatment. So these are the comorbid treatment, attention deficit disorder, but common is stress, anxiety, and mild depressions. And most of the treatment we offered is psychotherapy along with the other combined approach. It's a multimodal approach which we use because till now our experience also doesn't suggest we can go for specific interventions only. Parents groups we are running. This is another group we are doing. This is parent group we are running, or every month we run this parent group so the parents can also learn from each other experiences. And this is what we do when the child comes to us. We start with assessment, therapeutic alliance. Therapeutic alliance is spend time with the child because sometimes children take 2-3 weeks to develop that rapport and trust in you that you are the person. Because sometimes when we get the feedback after 2 years or 3 years, they say, I always wanted to talk to you, but my parents didn't understand me. So I think that level of understanding you have to give it to the child, that you are the person who can only then you can, once you get into that psychological space of child, only then you can bring the journey of change. Interventions, it can be this is an 8-session program. I can share this paper also, you can use it for your reference. And family support group. This is what the summary of our program. We start with rapport building, motivation enhancement, psychoeducation, then brief MET work with all assessments we do, internet gaming. Now we have validated internet gaming in Indian context. We have developed internet addiction test also in Indian context. We have mobile addiction test in Indian context, cyberchondria scale, which was the reason we have an Indian validation of it, and a smartphone addiction tool. Then we use CBT and BT combination, which includes behavioral activation and contingency management. But we have also matched with the stages of motivation also, if you see. But this is the guidelines. It may not mean that all 8 sessions you can go in the same flow. 8 session may go for 3 months, it may go for 6 months also. Then comes CBT, where we work on cognitive restructuring. And then comes termination and relaxation, where we work on consolidation. But along with this, we have a different phase where we go for elective sessions. Where we elective means where we work with families if family intervention is required. We work with stress management. We work with anger management. We work with study skills and other things also. Depend upon child to child. But I think always, as I said, this is a brief thing. It remains a task how to build up this trust. It's required, as I said, your knowledge about technology and your ability to deliver that conduct your session, where child can see that at least I can want to talk to you. So there sometimes parents just say, after seeing you, at least there is some change that he is taking bath regularly. That maybe child parents feel okay. At least my child is taking bath, taking food. Though academic is a different issue, but that's a change for us. So I think because of time constraint, I may not go much into these details. But again, affirmation is one technique. These are some simple techniques of interviews which you can use in your to conduct your session. These are some thought process. I think along with the devices and all, these are some cognitive work if you want to do. People say I'm worthless offline, but very important online, quite common. Failure in real world, success in the online world. Nobody cares for me. That's why I immerse myself, because my parents are busy with technology. Because child say, why don't you treat my parents? But parents say, no, we don't have treatment. They say laughingly that no, this is a problem with him only. Because sometimes it's a displacement, projection, a lot of things come. Nobody accepts the problem. Parents also remain in denial mode. They don't accept that they also have a problem. Negative evaluation of self could be guilt, anxiety, and fear, which may be related with the thought process only. So now I think along with these things, what we can simple things is digital fasting. All of us have fasting is in our culture. Only we have to bring one more word, digital fasting. Some time of the day spent without technology. If that is happening, we can develop the control, because control will not come through our advice. It will come through practice only. Digital hygiene is every half an hour or 40 minutes of screen use. Take a break for 2 minutes, 3 minutes. The break can include blink your eyes 10 times, move your head forward, backward 5 times each, right, left 5 times each, move your wrist clockwise and anti-clockwise 5 times each. 4-step simple exercise. Every 40 minutes if you do, you can easily manage digital burnout and addiction also. Then again, another thing which comes up for children are headphone use. Even adults also. We have a habit of using headphone over X number of hours in a day. Advice is till now is every 45 minutes of headphone use, take a 15-minute break. Simple advice. I think sometimes children carry those advice. They say he is not taking away our technology. He's just giving us some advice. And this advice works wonder. And sometimes again it's means 60 to 90 minutes physical activities. All of us are losing that activities. I think nowadays people earlier used to say 10,000 steps in a day is good for health. Now it has become 40,000 steps. So I think that much is the physical all of us need. And at least half an hour before sleeping time is the advice that if we can be without technology. Let's have one activity at one time, food without technology. If that rules also comes in the family, things can work wonder. And digital literacy. And these are some information materials which you can, I think I can share with you all. Our materials are in public domains. You can always download and can inform. This is the helpline which we are running. This runs on every Friday, 10 to 1 a.m. You can share this number in case if you feel somebody will benefit through our interactions, we can help them to give them guidance. So I think this is what I'm talking about. This is a picture which we are doing. This is called digital resilience. And digital resilience, if you it includes your family factor, community factor. This is a summary of my first two previous speakers' content, which I have summarized in digital. And this is what we have to build up now. And once the digital resilience comes up, it will decrease your digital burnout. It will decrease your cyberbullying, doom surfing, which doom scrolling and all came during COVID time, and digital failures also. So works toward digital resilience. Psychological resilience is the talk of the past now, because digital resilience includes psychological resilience also. And all these things we have developed, published also. So we make it, whatever we do, we made it scientific also, so that it remains in scientific domains also. But again, the change is, as I think my previous speaker said, how much is too much? One of our PhD scholars is doing work in this area, so we are building up guidelines for working population from 25 to 35, because there not much work is there. Everybody is talking about adolescent only, but there is nothing about. In his pilot work, we found 10 hours is the average time among working population in Indian context. It's a pilot work, but 10 hours is also too much. I'm not sure the 10 hours is for recreational use or for professional use. Esports and gaming, we have to define, are we promoting esports or are we treating gaming addiction? That's ethical dilemma. Do we have higher degree of social isolation, 21st century phenomena because of technology? Are we losing out attachment in real world? Could be because that is shifting us. Developing evidence-based psychopathology for internet gaming, AI, and online application, because ChatGPT and a lot of other things have come up. And strategies to promote, these are remains a challenge for technology. I think again, when we run the clinics, building awareness at community level is the first task which we have to do. Research tool to develop tools, interventions, and avoiding profession, because we know as when we work with children, professional burnout is significant. We have to work with ourselves also, so that we can help this population in a larger way. These are our some materials. Again, is available freely. We can also share with you. And these are our posters and all. Thank you. Thank you.
Thank you, Professor Sharma, for that excellent presentation. I'm sure it was really helpful to all the audiences. As I've been told that we are running short of time, so we have a few minutes for a few quick questions, please. Any questions? Yeah, yes, please.
Hello, sir. Very interesting discussion and presentation. And I just have one small reflective question from what I have been attending to from the morning sessions. Do you feel that school mental health program, like having a more effective school mental health program, is directly related to addressing the issue of internet addiction in adolescent population and children? Because from what I have seen while attending to cases in the clinic, is that some of the issues, like which all of the speakers have already discussed, isolation, having no friends, and using gaming and internet to cope from bullying, and problems like body image issues, is very evident among the children and adolescents. So do you feel that more community related interventions in the field of school mental health program is something which we might want to look forward to while addressing the problems of internet addiction as well?
I think the school mental health program definitely has a merit if he works on various psychological issues. If he works on psychological issues, as well as the focus can also be on life skill training, because life skill trainings also includes your works on emotional intelligence, emotional resilience, as well as it will also help the children to deal with XYZ situations or risk factors also. I think that can also be the focus in the school mental health program, but definitely it has advantage. I think we have, I think one flyer I have shared with Dr. Praveen also. We have one information where we have talked about what type of games are available and which type of games have a high tendency for excessive use and addictive use also. No, you can't, but I think for the text-based knowledge, some information we have built up, which you can just, if you just read it, it will help you to know. I think I shared the soft copy, so I think Dr. Praveen can share.
Any other questions? Then we'll close the session. Yeah. Thanks a lot, everybody. Thank you.
Thank you, sir. Thank you for a very informative session. Now I call upon Dr. Indrajit Sen Gupta to felicitate the speaker and the chairperson. Thank you, sir. We'll have a short lunch break, 20 minutes. The lunch will be served here. Thank you.
আমি আবার জিজ্ঞেস করলাম কমার্সে গ্রাজুয়েশন করেছে তারপরে
इसके बाद मैं We'll start the next session in 5 minutes. By 3.
Which one? Principal. So we'll start. We'll be starting in another 2 minutes. That's it.
We'll move on to the next scientific session, Parenting in Digital Age. I call upon Dr. Gautam Banerjee and Dr. Pratama Chaudhary to chair the sessions. Dr. Gautam Banerjee has 24 years of experience in teaching psychiatry and is currently professor and head of Department of Psychiatry, Medical College, Kolkata. And Dr. Pratama Chaudhary is a professor with West Bengal Medical Education Services. She has special interest in child and adolescent psychiatry. And today's session will be by Dr. K. Raman.
I have given idea. Yeah, it's there.
Just a second. He really doesn't need much of introduction. Welcome back, all of you from lunch. Is this working? Can you hear? Okay. So, Dr. Raman, you can see from here, he is a senior consultant psychiatrist with the Apollo Hospitals, Chennai.
and he's an associate professor at the Savita Medical College with 13 years of stellar experience in academic and clinical setting. He has done his postdoctoral fellowship in child and adolescent psychiatry from CMC Vellore, and has he has several uh, publications, and he's the recipient of the prestigious Nilofer Award for Best Paper on Early Intervention in Autism Spectrum Disorder in 2015. His areas of interest are parenting, behavioral and emotional problems in children and adolescents. He's mostly interested in working with children and adolescents. I've heard him speak before. I know he's an excellent speaker, so he's going to keep you on your this thing for the next session. Thank you so much, Dr. Raman. Please.
Yes. Good afternoon, everyone. At the outset, I would like to thank INK and Dr. Praveen Kumar and his team for inviting me again. And it's always a pleasure to be back in INK and be part of the academic feast. And thank you both the chairpersons for introducing me. And the topic for today is like parenting in digital age. Like we have the pre-lunch session and post-lunch session. I think you can actually divide the parenting into pre-digital era and post-digital era. So the parenting, the traditional parenting styles that we have been taught forever is, I think you all must be aware of this authoritative parenting, authoritarian parenting, permissive parenting. So these parenting styles do not exist, do not hold good anymore in the current digital era. So we will just be giving I'll be giving an overview of the parent. So there are a lot of studies also, but like here I'm not going into the details of the study because this is an overview of the internet related to the internet addiction. Okay. So what I would just do is like I will just take you through what are the changes of children in digital era and what is meant by digital parenting and how to become a good digital parent, and the parenting styles in digital age and what parenting strategies are essential to have a control over the digital usage. So if you just look broadly at the challenges that digital era has brought in, the most important thing is we are all aware that since morning we are hearing that we are completely hooked on to or dependent on the technology, and many times we feel that like without technology like we won't be able to actually do anything. We are looking at a generation of students who can use chatbot and chat GPT to get most of their academic work also done these days. So we as like maybe parents can actually look forward to AI based applications to find out like how servers asking that like servers just projecting some information. Those information, some of the information are available in AI based applications also when we just like give the right input. So similarly, children are and students are also smart enough to get the similar kind of information from the same AI based applications. Is the sad scenario that technology has brought in. Probably the creative thinking part and the reasoning capacity of the children and school going, particularly school going children and adolescents in a critical period will become a question because of some of the applications or some of the technology. Although benefits are there, advantages are there, we are looking at balance. So definitely, I think sir was highlighting on how it can have an impact on the development and neural plasticity. So there is definitely detrimental effects on the social and emotional development. If not, like we will not be, if it's just a benefit, we are not going to have any session or any seminar on these aspects, because like it is having a huge impact on the developmental aspects of a child. That is when we just need to address it. Promoting responsible and balanced use of online platforms. This is extremely difficult because like creating a balance on what is useful, how much it is beneficial, and where is the thin line that is drawn between what is excessive. So this is always a challenge in the digital era. So we all, when the child is asked like, okay, what are you doing? So I'm just like doing the homework. So all my materials are just provided through my online like platform. So I'm just focusing on that. So if this is the answer that is going to happen, and schools also encourage like online materials that is to be downloaded and actually viewed by the child, and the parent also have to take responsibility of the online material, that's a big challenge, because like we do not know what is like education like that is to be imparted, and where it becomes like recreational and problematic abuse. Understanding the underlying reasons, like this is also very important. Why like what are all the reasons why a child or a parent or a family is using technology. Ensuring online safety and well-being, this is what is the next speaker is going to talk about, the impact of online platforms and their consequences, problematic consequences. So this is very important, because many times, like as I was saying, many children are extremely looking for virtual friends. So virtual friends are becoming more common nowadays. We don't say like label anybody as like a autistic just because they are having virtual friends, because many of them are having preferring virtual friends. Probably some of the attributes of personality like low self-esteem, loneliness, isolation, they just prefer to be uncomfortable, like socially anxious. So they prefer to make like virtual friends. So these challenges are continuously there, and importance of real life experiences and fostering. So how do we ensure that these offline activities are going to be fostering very good development compared to the online activities? So now this is the huge gap between the current day parents and the children. So children are called as digital natives, whereas our parents are called as digital migrants, because like as parents of digital era, we need to actually carry the care and the wisdom of the traditional parenting, but we need to have the knowledge and awareness of the current digital resources. So then only we can actually have a balanced parenting in this current era. So we all know that like we had passed from our grandparents, like who belong to the car generation, we say. So then we all were like, or the current parents are like, they would just say that like we're all phone generation. So now we are just moving into a group of generation who are digital generation. So if the current generation parents are like, they will be much more digitally smart. So digitally smart parents, they have just looked at like how younger parents who have a very good digital knowledge, how they can handle their children, to born children and newly born children, in a much better way than a parent who is currently having a child in a 6th or 7th standard, or who is having an adolescence in 10th and 12th standard. So there is a definite gap between, because of the lack of awareness of the digital resources. So like, you know that like it is becoming an imperative, which is say that like online and offline, there's nothing called like you can delineate online and offline resources. So like online, offline life for a young children or an adolescent, because they are completely fused into your day-to-day life. So where to draw this line, it is very difficult, because now there are virtual reality games for children. So I think like they just enjoy virtual reality games like more than just going and playing a soccer or a football outside. So they just get immersed in this virtual reality environment. Technology is embedded, and it's not just an add-on part. So previously it was just an add-on part, like I'll just give the mobile for half an hour, you finish all your homework. That's not going to be part of the current day parenting style. It is just going to be technology is embedded as part of the life. So now there is a need for digital literacy, both from the children perspective as well as from the parents perspective, and the entire family needs to be arranged, even grandparents, because we are looking at both working parents, means the grandparents are also need to be aware of the digital resources, because that's the challenge for the elderly grandparents also. So as I told you, the digital era, like there are a lot of opportunities for new learning, but like there is also like there is digital danger. So this delineation is a very big challenge for the current day children. So this is like age wise, like how children would actually start using mobile phones or any social media platforms or anything, and where parents can actually start working on with their children. So if you just look at infants, the need, as it was highlighted like in the guidelines also, that like less than 18 months, it can just show a child or an infant through a video call to your relative. That's all is allowed, and even that is not encourage, you can just like do it if at all you are you just wanted to actually show it to your relatives. So during the space, the parents are the primary source of actually persons who are actually into the technology. So definitely that infant is not going to be exposed to the technology without the parents' support. So the parents are the good role models. So the child actually learns, models the behavior, appropriate behavior. So ideally, when you start the infant, when the child starts infancy itself, a good appropriate for a parent modeling behavior should be executed in the home background. Because like since sir was actually highlighting very relevantly, internet addiction disorder, the core component or the problem behavior can also start from modeling parent or a family behavior. If there are no adequate behavioral control practices at place in the home, then it is going to be very chaotic. So anybody can use, or anybody can just sleep at like 11 o'clock, 1 o'clock. There is no behavioral control in place. And all of them, as sir was saying, highlighting some elderly parents in their own room and texting that like, I'm coming at 11 o'clock, I'm just coming at eating at 9 o'clock. If that is the family rule that is existing, that is also going to create a problem, because the child knows very well that everybody is not coming together for lunch and everybody can just access their mobile phone during lunch or during dinner. That's the family rule. So which all are very, very important. And I would say that ideally, more conscious parenting is important. So the conscious parenting is like being aware of what are all the faults that we are actually doing, and then trying to actually correct it as and when like appropriate. Or if there is a feedback from others, then we need to actually appropriately change. There's nothing like previously and all that the traditional parenting will be more consistent parenting. It is not anymore in the current era. It is more dynamic. It is a dynamic process. So we need to learn, relearn, and then adapt few strategies from learning from the children, and then incorporate that into our like parenting practices. This is how it should be. Okay. So prioritize real life and face-to-face activities for infants. So it is most important. So if you just like make them expose them to the real life and the face-to-face activities, that is going to carry. So the child starts enjoying the face-to-face activities means obviously that is going to have an impact, that like you're not introducing the mobile. So early exposure, so availability and accessibility again. So we are coming back to the same picture of like for the all the substance use or all the behavioral addiction. If it is children 4 to 8 years, the main focus of digital usage is like for playing games, or to begin reading and writing, or we were just going to show something for the child more for an academic perspective. Okay. And for 9 to 12, these days, like there are certain assignments that are being given. And these are the two ages where there should be something called as, we call it as family media agreements. So this can be actually developed. It's like an agreement which the family can actually devise along with the child. So because these are the two ages where the children will be they can be actually pruned a little. But when they go into their adolescence and they strive for autonomy and independency, then we are going to have a tough time. So that is why these are the two ages where you can actually modify your parenting strategy, and in a way that like you can implement certain media agreements that like, say for example, there are these places in the house where like no technology should be used, like no forms of technology in washrooms, in in the bedroom. So even as parents, they are not supposed to use it. That is how role modeling happens. And then in the lunch table or the dinner table. So I would not be using this. Look, as a family, they will have to actually abide by all these rules at every point of time. So then only these things can actually work out. So these are the two crucial ages where there can be some control or stringent control on authoritative parenting style could just like fall in place for as far as digital control happens. But here again, social networking sites nowadays, like children get exposed to social networking much earlier, so around 6 to 8. So that's the age like social networking sites can be. But there are certain sites like which ask for about 13 years. So that is why the restriction comes. So 13 to 18 years like is an ideal age for actually venturing out into social networking. And the only thing in the parenting aspect that helps is a trustful relationship with an adolescent. So if the parents have a very good or a trustful and an open communication with an adolescent, that is what is going to play a role in such age groups. So you know that like digital resources or any form of mobile or any form of email, WhatsApp chat, social networking, all these actually promote why an adolescent engages is because of all these things. We know very well. So novelty seeking behavior. If a child or an adolescent has a novelty seeking behavior, they are just going to experiment with lot of things. But there are lots of advantages for gaming also, benefits also that has been displayed. So you can just like look at like spatial coordination, eye-hand coordination, visual eye tracking can be, eye tracking can be beneficial, and leadership and cooperative skills. So there's a lot of skills like that can be actually made beneficial through an online internet gaming, provided there is a check on the timing and other things. So these are all the reasons why, like which sir has also pointed out, it is a form of communication. They try to connect, or they try to adventurous. They think there is a sense of belonging in the community, and these are all the reasons why they use. So is parenting different in this era? Is it something new? I think it's an old wine in a new bottle. So what we will have to actually look at is, earlier it was, say for example, previously also our parents would control us in terms of, say for example, a romantic scene comes in the TV. So immediately what would our parent do? They would just switch it off, or they would just change the channel so that like we don't watch. So this was some form of a control strategy or a solicitation strategy that was used. So now, when digital technology was not there, when a lot of offline activities was there, probably when I was young and all, there were like we were having a lot of like games, we were playing on the road and all those things. That time also some behavioral control was there. Like if you are supposed to be there by 8 o'clock in the night, and you should not be wandering in the streets like so late, and with a particular street like you should not be going, and these are a group of people that you should not be mingling. So many restrictions were there. So this was never new. But that time it was only one box in the middle of the house. Okay, now it is all this all over the house. So that is where the problem comes. So there is like the kind of restrictions and the parent controls, it is extremely difficult. So parenting control is going to be difficult. So earlier it was either control versus certain solicitation is basically some supervised control. Okay, so there was either restrictive mode or there was like active mode. So like either restrictive mode is like you prevent children from doing certain activities, or active mode is you say that okay, you can just do this provided you are actually coming back in time. So that is what is active mode. Or social co-viewing, that where you will be engaging along with the child and just like engage in whatever activities they are actually doing. Say for example, if a girl child culture based, like if a girl child wants to actually go in the evening like to a particular place, then mother will say that I will also accompany you to your friend's house. That was there before. Now what will be mother also or a parent should be doing is, what activity that you are actually watching, then I will also sit with you, let me also interact with, know who are your Facebook friends. So that is what is the current social co-viewing. This was like, I'm just talking about like the era previously and how it is now changing. Now we talk about not the parenting styles, it's like more of a parental mediation. Okay, so the parental mediation is grossly divided into restrictive mediation and enabling mediation. So restrictive mediation is one parent who sets strict limit setting for the child. So that is what is like restrictive type. Restrictive type is limit setting for the child. Say for example, 6 to 6:30 is the time for your internet. Okay, so or completely like saying no to the internet. So these are all restrictive methods. Whereas enabling mediation is encouraging the child to explore the internet, but at the same time actually having a check on what are their activities, also exposing them to productive learning through internet. So this is what is enabling mediation. So we know that positive parenting style, like these characteristics and dimensions can be applied to the digital parenting also. The digital parenting, what I'm saying is like wherever like you will have to actually monitor online activities or be aware of the online resources. So these are all the characteristics of a positive parenting. The dimensions was given by like WHO And one is most important thing is connection and communication. So just as I was talking repeatedly, I'm going to say a good parenting style in the current era involves an open and a trustful and non-judgmental communication. So more than more than the child getting a trust in a psychiatrist or a psychologist or a professional, if the child can develop the same trustful relationship with the parent, and they are the first and the most important source of support in this treatment process, I would say. And like the rest all, because they are going to be confined to the house, many a times we get calls saying that like a child is confined to the house and he will not come out. So how many of the psychologists or how many of the psychiatrists will be willing to go and visit a child in the house in their home environment? What if the child just locks inside the house and says that, no, I don't want to meet anybody? How long can you wait? So these are all the practical difficulties. So that is why the parents also acts very late, and such cases are brought to us. Like many times, like parents are really helpless, and school tries, teachers try, and everything goes waste. And then we do not know that sometimes we'll have to involuntarily admit the child. So that are all extreme and severe cases. But the most important thing is parents' awareness at a much earlier age and connection and communication. Second one is behavioral control, and just give them the respect for autonomy. So we just know the Erickson stage, like the autonomy is most important for the adolescent period. So that is when they just say that privacy. So this was a parent, and a 12th standard old girl, and she said that the parents expect that because she was actually sexting, she was actually getting into a lot of relationships through online, she was posing her nude pictures. This was a concern which they discovered, and then they came into an agreement that there will be fixed time of usage and she'll be sharing the password and everything. But her argument was that I will sit in my room only, but I'll keep the door open at the maximum. That's all I can do for your sake. So this kind of bargaining keeps happening during the therapy process because they still need that privacy. They still need that individuality to be looked into. Okay, and modeling of appropriate behavior and protection policies. Okay, so as I was telling you, these are all the traditional parenting styles. Okay, and I think you must be aware of what is called helicopter parenting also. It's called overprotective parenting. They just hover over everything that the actually child is doing. This is extremely going to be dangerous in some situations because some parents strictly monitor. Say there are certain parents, what they will do is the child will be sitting in another room and they have online access here also, and they will be monitoring whatever is happening. Sometimes they'll be made to do that. So that such parents are also available. Okay. Snowplow parenting is where parenting, they will actually give access to online, but wherever required, they will actually restrict the usages. So they will be aware of the websites or the other online accesses which needs restrictions. They will not provide access to such online access alone. So that is what is plow parenting. So these are all parenting styles which was originally existing, traditional parenting, which we can apply to our own digital era as well. Okay, what are the parenting skills that are required in the digital era to actually facilitate smooth functioning or raising of the child? Is one is communication skill. The second one is critical thinking. See, many times parents come to us in a state that should I give it off to him to prevent actually aggression, or should I request him to go to school? They'll be really going through an ambivalence or turmoil in terms of decision making itself. So as I was saying, there is no one size that fits the shoe. Okay, so it is very individualized. So that moment, say for example, the same instruction that we give to the parent on this day to maybe another week time. Sir, you told me this to follow. I was following the same. And since again, he is going back to the same one. So what should I do? Now we will have to tailor-made at that point what needs to be done. So that is what critical thinking is extremely important that the parent have to actually apply. And whatever strategy that we are employing, that has to be continuous and consistent. Otherwise, if at all there is going to be a burnout, the child will also go back to the square one. So that is most important. And the community, which is most important, I think sir just highlighted. I also wanted to emphasize the importance of peer parent support group. So we always talk about peer student group. I think in this case, like peer parent support group, because they already have a peer student group, right? Because they'll be playing games through only their peers in the late night. So they have a group of people, they will join, then only they will all be part of the game. Okay. So, but here most important is creating a peer parent support group. So community, and that is when like they know, like see, it is almost like how there is a support group available for certain conditions where there are no scientific evidence or guidelines are applicable. So say for example, some parents, like the support group for autism is available, so they will just like discuss, okay, my child was like having this issues, I handled this like this. Okay, so like they will get input and feedback from that. So this is extremely important if you are looking at a clinic also. Like I think comprehensive assessment of internet addiction should also incorporate assessing the belief systems in the house and the parenting rules, parenting strategies, parenting practices, everything that is happening at home. Yeah, sure. Okay, so authoritarian parenting is like high demand. The people who place high demand, okay, and they do not provide warmth required. Okay, so there is a high control over the children's behavior, but there is no warmth or nurturing provided. Okay, whereas authoritative parenting is there is a control along with warmth and nurturing. That means you are available, okay, for the child, for like any of the, say for example, you firmly set limits for a behavior, but at the same time you are not so punitive or punishing. So that is what is authority. Ideal is, that is what we were taught actually, but now like we have to use some mix and match of all the techniques. Okay, so looking at the dimensions, this is just an example I just had given. Okay, I'll just go to the next. Okay, so these are the styles. Other than the usual traditional styles, we can classify the parenting styles into either enablers, limiters, or mentors. These are the styles that we can actually currently process into. Okay, I try to look at like if there are any scales available or a tool available for assessing the parenting, digital parenting styles, but like I think there are none. There are digital parenting toolbox available. Okay, but there is one scale which I just found that like it was called as perceived parent mediation scale. This was based on a supporting parenting model. Basically, it is to understand parents' encouragement of children's opinion in response to non-complaint. So basically, what it does is like just parents' perception of child's behavioral responses. Okay. So now with all these understanding, we should encourage parents to shift from the traditional parenting style. Now there is a concept called as transcendental parenting. So the transcendental parenting talks about, it's not that like you just focus on development of the child in one aspect alone. Say for example, mother focuses on only academics. The father encourages only sports activities. Transcendental parenting encompasses all aspects of development. So you really need to actually be aware of the technological knowledge. So such is the challenge for the parenting in the current era. So you need to be aware of the technology, most important, and beyond what child might be also be knowing, because many times parents come to us and say that I did all the things possible, but still he comes out with another strategy to just like use it. So maybe like many times they just try applying all the parental controls and everything. Now they try finding out bypass to actually to just overcome that also or supersede that also. So one is like knowing about the technology part. And the second one is like providing all opportunities in the offline environment. So the nurturing skills have to be more, it should be also transcendental. So that means like it should not be restricted to the home environment alone. It should be restricted to the entire like environment where the child is actually rearing. So such is the actually like that, such is the ideal parenting skill that is required, which is talked in the literature. Okay, so now like the term digital parenting means its efforts and practices for comprehending, supporting, and regulating children's activities in the digital environment. For that, you need to have, there are a lot of studies which have looked at like digital parenting knowledge. Okay, so like digital parenting, they have assessed based on like certain parameters and certain criteria. Based on that, they have classified parents into media centric, media moderate, and media light. So like there are different studies. They're all studies based. There are no validated tools that I could come across. So ideally, digital parenting parents should be able to supervise their children's online activity, and they should be also be competent enough to address the risk, challenges, and opportunities, and they should be able to bridge the digital generation gap. If at all a child is actually happy that like okay, happy to know that the parent is having a good digital knowledge, there is a possibility that it increases confidence of the child to confide on the parents. So this is most important, because as sir was saying, I'm not going to be a second parent. But if the parent is having a good, adequate knowledge and like a trust, able to build the trust and everything, the child will have ability to confide on to the parents about their whatever technology aspects that they are exploring, whatever online platforms that they are venturing out into, the risk that they are actually encountering, how to overcome such risk. All those discussion can happen between a parent and a child, provided the parent has digital literacy. So otherwise, it's going to be difficult. So just to summarize, and a good parenting strategy that can help out us, let's be a good role model, ensure that open communication and non-judgmental communication happens with the child at periodic intervals. As again, I would say, point out what sir was saying, half an hour of like talking, we do not know what to talk. So such is the case. Like those days and all, like, we'll have to tell them during the dinner, you are not supposed to watch TV. During the dinner, like you are all supposed to say what happened in your workplace. They are all supposed to say what happened in their school day. So such things we will have to teach them now. Such as the state. Like we will have to tell them what to talk. Okay, so such as the state. Monitor and track all the digital activities. For that, be aware of all the apps. There are lots of information available. Like you can just know like what are all the parent controlling apps that are available, what are all apps available to track the activities, digital activities of the students that is available. Okay, this is what I would like to highlight. Be ready to learn, unlearn, and relearn. So if at all you are so flexible and dynamic only, current day parenting is going to be like successful parenting. Okay. So of course, like we will go through this process. It is a process. So definitely we will go through guilt for rearing. So this was always there. So it is nothing like okay, there is something like you win. That means like your child is going to actually progress in the right line. Exercise parental controls and develop a virtual inventory. Okay. So this are all the list of like digital control strategies that the parent can actually develop, but everything starts with the communication with the child. So that's what this, I would say, start communicating with the child. Even you can just like get online and ask, say for example, a child, the self-esteem of the child, which I was talking about in Maslow's pyramid. Okay. So many times, like I had seen that, like when I just go and ask my junior to help me with the online thing, I think they feel really good. Oh, I'm able to help my professor. He is going to impart certain knowledge, and I'm helping him with something else, like which he doesn't know, which he doesn't, which is handicapped. Okay. Similarly, children also will be really liking if a mother or a father says, "Hey, come on, I do not know." Like, so that is a way of also testing and finding out how much your child knows about the online platforms. Okay. Hey, my friend told me like this. Are you aware of such things? I do not know how to do this. So learning from the child can also help in a way of a communication. Okay. So many times parents think that like they view it from a paranoid angle only. Oh my God, this girl knows this boy knows this. So I think that should also just, and play games with them whenever possible, and let them also teach you certain things, and you take it in the right spirit. Okay. Since morning we are hearing this. Indian Psychiatric Association Society has recommendations for screen time, and Indian Academy of Pediatrics has given screen time. Indian Association of Child and Adolescent Mental Health has provided screen time guidelines and everything. But ideally, like we will be surpassing all the guidelines that has been mentioned. So we won't be actually, in fact, if we follow that guidelines, most of us will be having problematic internet use. So, but this is what is ideal. So ideally, what I would suggest is like if at all the parent, There are newborn child, like you can actually implement few things. If at all in a young child, you can implement few things. Okay, so there are age cutoff and restrictions for platforms also. I think knowledge on all these things like will be beneficial. Okay. To summarize, take home message is like, just most important thing is be aware of the digital resources. Otherwise, like we would be putting a sorry figure in front of the children and adolescents, both in the therapy as well as in the home environment. Parenting is a dynamic process. Upgrade your skills as and when. It's not wrong to actually unwind our existing traditional fixed parenting practices. So active engagement and communication with the children and adolescent are the key rules. And work in unison with child's environment. This is more important because you really need to know what is a child's environment. So what all is part of the child's environment, starting from the school, starting from the friends, starting from the online friends, and everybody, or in the neighborhood, so adolescents with adult friends. So just find out like what is all happening in the child's environment, and work in unison with that to refine your skill. Okay, with that, I would just thank for the opportunity.
Thank you, Dr. Raman. That was an excellent session, I would say. Uh, to me, parent, this is an acronym. So, where P is playfulness, A is for authenticity or genuineness, R is for establishing relationships or using social cognition and everything, E is for empathizing. That is very important, and that is lacking in this age group, in this digital era, that is social emotional intelligence. And N is for no ultimatum. This is an unending story. That's why no ultimatum. You need to develop some amount of negotiation skill for that to create the win-win situation. And T is for togetherness. But I think, and in Dr. Ramon's session, that was unique, because we have to find out some way outs. That is important. What can we be pragmatic? What we can do. So we are running short of time. That's why one or two questions may be allowed. Thomas? Okay.
You're talking about the digital friends. How we can rely upon that? Because we have seen social media, a lot of fake identities are there, and we don't know about the age also. So that is one point. Second is, many times I've seen my patient, they are misguided by their digital friends. So can you highlight something?
I would just agree that forming virtual friends is not to be encouraged, and the identity of the friends are formed in the Facebook. So actually, there was one exercise which the parent can actually do with the child also. So many times, like children likes like Facebook friends. I have 560 friends. I have 1020 friends. So you may not be knowing about everybody. So a mother or a father can just discuss with a child like about like it's not the number of friends, and like you can actually need not be trusting everybody. So I was talking about the age, and I think gender also we may not know. So like the person who is posting on the opposite side, we really do not know what gender actually. They may just post as female, but they may be actually males, and that is how actually the current virtual environment is. So having an open communication with the child would facilitate to prevent or at least like the risk or dangers, exposure to risk and dangers. So for that we need to have an open communication. For that we need to know their own friends. That's what I was telling you. Their own environment is most important. Previously we used to bring the friends home. Nowadays, like they say, like I will just go out and have, I will just stay there. So you don't know who are all coming there. So previously, the number of friends who visit your home is low, one or two, and your mother knows very well if you're not there, she will call there. Okay, but now the child says that I'm at a particular place for a night party, and that is their right. They just claim, and they just go for a night party, and there we do not know how many people hang around. So it is very impractical to know, and one they exchange numbers immediately, and they become mutual friends there. So I would say that like virtual friends, we cannot prevent. We cannot prevent, but like at least the child has to be aware of the risk and dangers, what to share and what not to share, and ideally there should be a, like how we call it a sex education, or like a good touch bad touch is being taught. The child has to be also taught like, okay, so when we are sharing with a stranger, what to be share with a stranger, what information can we provide with a stranger, that information has to be provided as part of the the communication at home. So that's why I said like earlier we start, it's better. But sometimes when we pick up children very late, I think they have just crossed the boundary. So many times we come across like adolescents engaging in like unprotected sexual intercourse without any guilt also. So such is the scenario we are coming across. But we need to be really aware of the situation. I would say that
don't know whether I should barge in, because see, you can't possibly say that you will not make virtual friends, because it has opened up a new era. And you were saying we should teach them how to be. Do we really know where? Like that day, I was reading like a little older people, young people, when they're really going to serious dating. Many people are saying they'll prefer LinkedIn profiles rather than Tinder or Bumble, because they feel that the profiles there they're authenticity. So can we really have something like that for young children, like you said? So something like that where it's only authentic people will be. You can't possibly tell them no, don't make virtual friends when we are preaching that the world is one place for us to. So I don't know. I'm a migrant, digital. I'm migrating up the ladder. So please let me know if there's anything that.
I don't think so, sir. We can just make some general rules like that. But only thing that I can just say that is it's not the virtual friendships that we have. Even real friends, like we may not know many people. So it's not that, but like I think we can sensitize the children on the risk and dangers and what to share and what not to share in a public platform or a social media platform. So that is what we have to just do, and probably a quick check every time. So maybe that is what many times parents miss also. So I have told already, I didn't know that like I she took it so seriously. She cried in front of me. I thought like okay, she has changed and all those things. But like then the trust factor builds up, and then they just leave it off. That's why I said continuity is extremely important. We need to keep a quick check on every time. Okay, how are they doing? Are they still in touch? Are they having still the online platform usage more? So this regular activity would only reduce the risk associated with online activities.
One point just so we can use just to determine, just to find out who is the risky friend or not. We can use the zona proximal developmental scheme by Vygotsky, because unless there is transparency between parents and children, that is very difficult. Otherwise, that's why co-using the playing games or other digital media using, that is more important. That creates the transparency. Okay.
Thank you, sir. Most of us here are parents, so your session was very enlightening and practical. I now request Dr. Manoj Kumar Sharma to felicitate the speaker and the chairpersons. Okay.
Good afternoon, sir. So talking about Instagram and social media influences, somewhere, deep down, we also know, the viewers also know that what they present on Instagram is not what they actually are. And, unconsciously comparing ourselves with them, it somewhere, it hurts our self-esteem. But in spite of this, some people actually they because it is so indulged in our, and it is so ingrained in our culture, in the modern culture, that some people actually want to become, and they're aspiring to become, a social media influencer or a social media icon. So how can a young teenager who is aspiring to become a social media icon follow that career path without getting too indulged in this culture and actually hurting themselves in a way?
It's not a very simple answer that I can provide, but like a self-regulation is something that we need to actually learn. Okay, because I understand that like when passion overrides our conscience, so that is when we are just like becoming prey to all these online activities and everything. But like the self-regulation is something that we learn, or we'll have to just cultivate and learn over time. So what is relevant is what relevant information that you really need, you just seek for it. If you just need guidance, then you have to actually have some mentor or somebody. And because like if you want to become a social influencer or somebody like, or choose a career path or something like, just have a mentor or somebody to guide you, so that they will actually you can have a open discussion with them. So this is what I'm just aspiring to, but like I'm just getting deterrence like this. So just they will be able to guide. So have a good mentor or somebody, they will be able to help you out.
Thank you so much, sir. We would now move on to our next topic of the day, talking to your patients about cyberbullying and sexting. We have a speaker with us, Dr. Deepshikha Rai. I'd like to call upon our chairpersons for this topic, Ms. Anindita Mukherjee and Ms. Suchandra Chakraborty. Ms. Anindita Mukherjee is working as a clinical psychologist under the West Bengal Health Sciences. She's completed her master's and MPhil from the University of Calcutta. She's currently pursuing her PhD from the University of Calcutta. She has been working for the last 12 years in this field. She's mainly interested in dealing with clients' dialectical behavior therapy, mindfulness-based therapies, behavior therapies in children. Our next chairperson for the event is Ms. Suchandra Chakraborty. She's consultant clinical psychologist at the Institute of Neurosciences. I'd like to call upon Ms. Anindita Mukherjee to introduce the speaker of our day, Dr. Deepshikha Rai.
Dr. Deepshikha Rai is an associate professor. He's currently working as an associate professor in the University of Calcutta. Dr. Rai has recently received Writing Award from International Psychoanalytic Study Organization. She has several national and international papers and publications in the field of psychology, clinical psychology. And she is also a reviewer and reputed peer-reviewed journal like Asia Journal of Psychiatry, SAGE, Open International Journal of Social Psychiatry, Frontier of Psychiatry, and Indian Journal of Public Health. So it's all, the rest is to Dr. Deepshikha Rai.
Okay. Good afternoon. I would be talking about cyberbullying and sexting. Before that, thank you for the introduction, Anindita. I am particularly happy because they are all my students. So I love to share the stage with them. So before we go on to okay, I'll have to look here then. Before we go on to the concept of cyberbullying, let us understand what bullying is. So it's okay. So bullying in childhood and adolescence, it's a kind of circular violence. It's intentional, it's systematic, it's yes, that would be better. Okay. Thank you. So before we move on to what is cyberbullying, first let us consider what bullying is. So as we know, it's a kind of circular violence. Circular means it occurs repeatedly, and then it's intentional and systematic. It's not provoked by the victim, and the most important issue is perhaps it is associated with imbalance of power and abuse. Now, any interpersonal violence between the peers has to be understood with the context of bullies who are perpetrators, the victims, and the bully victims who are both bullied in certain occasions and act as bullies in some other occasions. Also, we have to take into account the concept of bystanders who are there in the bullying space, in the relationship dynamics between the victim and the bully, who can either reinforce the bullies, that is, encourage them to bully further, who can act as defender or support for the victims, or who can simply be silent, passive spectators, which are known as the outsiders. So cyberbullying is a specific kind of bullying which definitely occurs in the digital era, through the use of electronic media like mobile phone, computers, internet, etc. Okay. So some researchers would say that cyberbullying is basically the same as traditional bullying, but modified in the context of the digital era. Some others would say that yes, it's true that there is a conceptual convergence between cyberbullying and traditional face-to-face bullying, but there are also distinct differences, because in face-to-face bullying, generally the bully and the victim, they know each other, whereas in cyberbullying they may not know each other, as we have already discussed that in the virtual space it is easier to assume false or alternative identities. So it has been seen that in case of cyberbullying, often the traditional bully-victim relationship gets modified. So people who are often bullied in the face-to-face situation may turn into cyberbullies, where they are virtually bullying others. Now, males have been found to be more often bullied by others in the cyberspace and resort to cyberbullying also more frequently. It is also believed by experts that cyberbullying, the effect of cyberbullying is perhaps more adverse in comparison to traditional face-to-face bullying, and around 30% of children worldwide have reported to be bullied at least once in their lifetime. Cyberbullying, once again, can be basically of three types: flaming, harassment, and exclusion. And this harassment can again be divided into subtypes based on very subtle distinctions. Flaming means when an individual is trying to provoke another individual through use of insinuating messages or images. Exclusion means when an individual is socially isolated on the basis of certain characteristics that may be race, ethnicity, gender, sexual orientation, etc. Harassment is basically sending unpleasant messages or images either for the purpose of instilling fear, we call it cyber stalking, or it may be to denigrate the individual, to insult the individual. It might be assuming of a false identity in the name of the individual and circulating offensive messages which indirectly affects the social image of the individual. It might be leaking out personal information of the individual or tricking the individual to share personal messages. So once again, when we were in the last session also, we were discussing about that, sir was discussing. So it's very important to teach children and adolescents what information they can share also in the virtual space, how to respect their personal boundaries also. So now, who are the children and adolescents who are more likely to be bullied, and who are the children and adolescents who are more likely to bully? There is no one single answer, but there are certain characteristics. Generally, bullies have been found to be low in assertiveness. They have poor trust and communication in the family or with the parents. Once again, bringing in the importance of parenting. They are generally more insecure, more anxious, and are often introvert. Now, another thing is that bullying also occurs, or bully victims are generally, they also are bullied in the context of appearance, that is whether they follow the typical physical norm of not being fat, clothing, body weight, looking good, as well as gender conforming behavior. So there is also a concept of body image. We always knew about the concept of self image. Nowadays we also have to be conscious about the children's body image, whether they consider themselves as beautiful or not. Antecedent related to bullies, generally they have been found to have punitive or restrictive parenting. They have a more positive attitude towards violence or aggression. They are more prone to watch violent media. Generally, their self-esteem is average, that is better than the victims, but they are impulsive and often they have difficulty following rules. The most important point perhaps is that they have more power. This more power can be literally in the physical sense of the term, that is they're more stronger, maybe they are stronger by virtue of the fact that they're older in age also, or they have more social power, that is they are kind of leaders in their peer group. The mental health consequences, or in general the negative consequences of cyberbullying: loneliness and isolation, anxiety, anger and self-harm, poor self-image and poor body image, which I have already pointed out, poor academic performance, often school dropout, physical problems like sleep disturbance, headache, abdominal pain, depression and suicidal ideation. Now, adverse mental health repercussions for bullying has been found to be more severe in case of the bully victims, that is those persons who act as bullies and are also bullied by others in some other occasions. It has also been found out that bully victims are particularly, they perceive the parents as rejecting, and they also have poor self-concept. Though we would be talking about sexting later on independently, but also since sexting is also a part of sexting can be considered in the context of cyberbullying, sexting has a higher negative impact in case of girls. That might be because all over the world the sexual norms are more stringent in case of females. So now, considering few studies, I have tried to develop this model. So basically it has been found out, interestingly, though the bully has better self-concept in comparison to the victim, but in general the victim as well as the bully, all of them have high neuroticism, low agreeableness and low extroversion, and this relationship is mediated by loneliness and low self-concept. So now we come to the concept of sexting. As I said, that basically sexting, in the context of what we are discussing today, sexting can be considered as a kind of cyber violence. But the basic definition of sexting says that it's the exchange of sexual materials by the use of electronic devices or media. So it does not include that issue of harm or maliciousness. So the definition of sexting varies upon the content of information that is being shared, the volitionality or willingness of the recipient, whether the recipient is wanting to receive that information or not, and definitely if there is any malicious intentions or not. Sexting can be of different types. For example, sending one's own sexually explicit images or sharing sexual images of someone else, and that too to third parties. Primary sexting means when two consensual individuals are sharing sexual information with each other, and it is not supposed to be shared to a third person. Secondary sexting means when a sexual message is being shared beyond the intended recipient, that is to a large group of audiences. Now, this brings forth to the concept of consensual and non-consensual sexting. So, primary sexting is generally supposed to be consensual, whereas secondary sexting is generally non-consensual in nature. And it is because of this non-consensual nature, or in any context, even in primary sexting, sometimes it might be sextortion. That is, a person is threatened to send sexual images to one single person maybe, but threatened to do so, not doing it out of his or her own will. So in that case, in any case where freedom of choice is compromised, that will have a harmful effect on the individual. So as I was saying, that there are some differing opinions on sexting. Some researchers say that considering that we are living in a digital era, so sexting might be just an alternative way of expressing of sexual needs and concerns in today's youth and adolescents. The riskiness or the harmfulness of sexting does not lie in the sharing of explicit sexual imagery, but the fact that through the use of technology, such personal information gets very rapidly gets transmitted to a large number of people, and even to people who were not initially the intended receivers. At the same time, it has also been found that sexting is associated with other high-risk sexual behaviors in adolescents and young adults, mostly cyber pornography, etc. So once again, when we are teaching the children about personal boundaries, we should also teach them about sexual boundaries also. What can be shared and what cannot be shared. Sexting definitely can affect mental and physical health of those involved, lead to depression, suicidal ideation. And as we have already seen that sexting, the negative impact of sexting is higher in girls in comparison to boys. Now we move over to the concept of motivations related to sexting. So once again, there can be so many motivations. As we have said, that some people say that it's purely sexual purposes related to intimacy and exploration and might be a prelude to sex. It might be related to body image dissatisfaction and the adolescent wanting to reinforce the body image, positive body image. It might be due to social pressure, which are peer pressure and partner pressure. And once again, girls have been found to be more giving into social pressures, but it might be instrumental or harmful, where one individual is explicitly and systematically and in a goal-directed manner trying to harm the image of another person through the use of sexual images. Now, as we have seen in the previous slide, sorry. Oh, I want to go back. So the harmful effect of instrumental sexting is more in comparison to other forms of sexting. So now we directly come over to the concept of intervention in cyberbullying or sexting. As we have said that in many occasions, sexting can also be considered as equivalent to cyberbullying. So there is a concept called theory of planned behavior, where we say that a behavior, its frequency and intensity of occurrence or its outcome actually depends upon certain antecedent factors, more specifically the intention of the behavior, the attitude of the person towards the behavior, the subjective norm of the person regarding what is right and wrong for himself or for others, the perceived behavioral control, how readily a person resorts to that behavior, and obviously presence of disapproval from peers. Based on that, there can be basically three types of intervention program: awareness program, social skills training, and parental education. Once again, we have to keep it in mind that all these programs are intended to include the families of the bullies as well as that of the victims. And it has been found out that in order to prevent any kind of bullying, in cyberspace or even in the physical space. The general public, the individuals who are being victimized, individuals who are perpetrating it, the witnesses, the silent spectators, or the general public needs to know about the extremely detrimental, deleterious effects of bullying on children and adolescents, the victims. This often is unknown to the general people, and as a result, often people cannot discriminate between bullying and minor so-called joking with people of the same age group. Coming back to the issue of bystanders, bystanders have been proven to play a very important role in prevention of cyberbullying because they can directly support the victim by contesting the perpetrator, or they can indirectly support the victim by talking about the bully event to an adult. Psychosocial factors that mediate bystander behavior are again the perceived sense of autonomy and self-efficacy of the bystander, the sense of anonymity. Bystanders are often more willing to help if their action, for example, in case of indirect support, when the bystander is reporting about the bully incident to a teacher or a parent or any adult authority figure, they prefer to remain anonymous. Past experience of cyberbullying. Now, this can have a positive as well as a negative effect on the bystander behavior. It might make the bystander more empathetic, or it might make the bystander once again follow a role of a passive aggressive person and kind of support the perpetrator. Identifying with the powerful person or aggressor, and fear of social exclusion. Now, this is very interesting. The need for affiliation that we have, for which we identify with certain social groups also, this is a very intrinsic need that we have, but unfortunately this need has prompted more of maladaptive behavior from us than adaptive behavior. This is true for adults as well. So people do more harm while identifying with a group and less harm when they are actually not identifying blindly with something. So fear of social exclusion is another reason why bystanders often remain silent, or are often kind of, they feel obligated to support the perpetrator. As we have, when we were talking about cyberbullying in general, then also we said that in case of cyberbullying, unlike in case of face-to-face bullying, the roles of bully and victim might interchange. Same in case of bystanders. Individuals who often are bullied in the physical space might act as bystanders, or vice versa in the cyberspace. This we have already talked about. Oh, again, I am pushing the different button. Sorry. Now, 5 stages have been identified that might occur while a bystander may resort to help the victim. As we can see that this is a very old reference, so probably this stage model was initially proposed in the context of face-to-face bullying. So it has been found out that 68% of people report that they have noticed bullying, but only 10% actually try to help the victim, which says that there is a missing link between this seeing and empathizing and taking action. Parental response in cyberbullying. So sir was talking about parental mediation. So once again, I'm coming to that. So there is the concept of active mediation, where the parents do not intrude into the private spaces of the children, but they make open discussions about how to behave online, and probably about what pleasant or unpleasant experiences they might have encountered. Restrictive mediation, limiting social media activity. Authoritarian surveillance, monitoring children's social media accounts and activity. And non-intrusive introspection, occasional monitoring of children's open posts, but not private conversations. Now, this restrictive and enabling parenting also lies in a continuum. Needless to say that more enabling, more supportive and communicative parenting leads to the development of a safer child and less risky behavior on the part of the child. It is also important to understand that parents often do not have adequate knowledge about how the virtual space is operating, and also not in addition to the absence of technical knowledge related to internet, the parents might also lack knowledge regarding what bullying is all about, and once again about the detrimental effects of bullying that can be there in their own child. So in case of intervention, this social skills training and awareness training can be thought to be two arms of the same intervention program, and they can be directed to both the bully as well as the victim and their respective parents. So teaching children and adolescents about empathy, respect and conflict management, openly talking and discussing about emotions, teaching perspective taking and role playing, teaching personal boundaries. This is particularly important in case of sexting, and reinforcing empathic and helpful behavior of the children whenever the parents get scope to do so. Now, as clinicians, this is very important. The earlier part was more related to the theoretical understanding of cyberbullying and sexting. So how do we identify that a child, my own child, is a bully or my own child is a victim? It's not about other people's children. It might be about my own child also. So my own child can be a bully. There are certain signs. For example, the child is more argumentative, gets angry more quickly, but also takes control or charge of situations in a less age-appropriate manner very quickly, is unduly confident, is often very bossy towards age mates, rarely shows empathy towards others, is good at convincing others to follow, always wants to win, and likes rough physical play. And how do I know that my child might be bullied? The child frequently loses or forgets belongings in school, or comes back with damaged school books, or maybe pencils and pens, has unexplained bruises or cuts, has few friends, seems afraid to go to school by a bus, or walk to school, or take part in community activities, losing interest in school and academics, poorly performing in academics, remains sad most of the time or anxious, and more particularly while coming back from school, complaints of vague physical complaints like stomachache, headache, and more particularly while the person has to go to school, can't sleep or complains of bad dreams, anxiety, and low self-esteem. And what to do if our child is a victim and if our child is a bully. So if the child is a bully, make it clear to your child that bullying is not okay. Hold your child accountable for every behavior. There has to be clear rules, and also rules for what will happen if the rules are violated. Limiting the child's exposure to violent television programs and games. Spending time with your child and paying attention to, once again, the concept of parenting coming, the involved parenting, who basically monitors not only in case of the victim parent, but also in case of the parent of the bully. The parent monitors what the child is doing in the virtual space. And if you identify these signs, then in spite of being the parent, talk about your child's bullying behavior with the teacher in the school, the principal, or the school counselor. And what to do if your child is a victim? Make sure your child knows that being bullied is not his or her fault. Encourage your child to talk about it. Don't criticize your child's personal, spontaneous way of dealing with the bully. Once again, you can contact your child's teacher, school counselor, principal to tell them immediately about your concerns. Teach the child ways to stay safe. For example, telling an adult if he or she is threatened. Make sure your child has a phone number of an adult who can help. But most importantly, provide your child with a safe and positive home environment so that the child has the trust in you to come back and complain to you if something negative is happening. These are the references. Thank you.
Thank you so much, ma'am, for such an enriching talk. I'd open the house for questions if anyone has anything to ask.
Wendell Fruit talk, ma'am. We become nostalgic again. So I have one question that is there any difference between the person who bullied another person face to face and cyberbullying? So is there any difference between perpetrators?
So difference as in terms of personality factors or psychosocial factors in the family environment, there are no differences. It's just an alternative space, as we are seeing that technology has mediated or pervaded all aspects of our lives. So naturally, the digital space is another space where the child can express inappropriate aggression. But definitely, we are giving more importance to cyberbullying because of the fact that in cyberbullying, additionally, the child or the adolescent can conceal the identity. So in case of physical bullying, the identity is more obvious and apparent and seen by everyone. So if I'm hitting a child, maybe the CCTV in the school campus sees it. So, but in case of cyberbullying, it becomes more difficult to identify who the bully is. But other basic factors in the child's personal and home environment or personality attributes, or if it is temperamental, since we are talking about adolescence also, those associated factors remain the same.
Another thing in bullying is that cyberbullying is something that someone is bullying. The person can bully to anybody. Like in the physical bullying, the accessibility might be only in the peer group or in the school. But whenever it's a cyberbullying, the person can bully to anyone. It might be to a celebrity, to an adult, anybody. And number one, number two thing is that if the person is cyber physical bullying can only occur might be in the school hours or in some restricted places, but in cyberbullying it can occur anytime. Like the person is watching the insta or Facebook in the night time, and during that time he got a very negative comment. So this is another difference between a cyberbullying and a normal bullying.
One thing that I'm thinking about that during when the person is doing face-to-face bullying, at that moment that person knows that my identity is disclosed. But when it is cyberbullying, they know that my identity is not anonymously. They can do it. So that can again like when I cannot express my like the bullying is kind of aggression that I'm showing, my direct aggression. Maybe form may be different, but when it is cyberbullying, so I'm doing it anonymously. So when I cannot express my aggression like directly, so I'm doing it anonymously, so I'm showing my aggression but not in that I cannot express in the real world.
That can be one of the explanations. One thing is that, as once again, that it has become, the digital world has become so pervasive that we really cannot do without it. So often, cyber bullying, the person who is resorting to cyber bullying might be a bully in the physical space also. But some persons who are not a bully in the physical space might turn out to be a cyber bully. So the relationship is, the basic thing is same. So if a person is a cyber bully, there is no need to think that the person is not a bully or a saintly person in the physical space. But the thing is that the other kind of relationships between bully victims are also apparent in the cyberspace. Rather, a person who is a victim in the physical space might resort to bullying in the cyberspace to vent out the pent up aggression as well as frustration whatever he or she has had in the physical space. So that's a complicated dimension.
Another one information I want to add, like sexting, as madam said, that is, it can be consensual, but if the person is below 18 in our country, then it will come under the POXO Act. And one of the biggest problem in POXO Act that if the both the party, like the boy or the girl, if it is the below 18, but if the girl is complaining against the boy will come to the juvenile home for the same act which is consensual. So the school should be very, like school mental health program, as a few sessions back we are discussing, the school mental health program, it should be clearly stated, especially to the boys, what is actually this POXO Act and how the act actually normally happen and what will be the adverse effect because of this act. So this is one of the problem thing in would like to mention in sexting.
Yes, individual laws of each country, that needs to be, the children needs to be trained about that also, because in our country this sexual violation laws are often very sexist in nature, in the sense that often males are persecuted more frequently for the same offense done by a female. So that's why the school needs to be sensitized, and the parents also need to know about that. And often open discussions and transparency, trust between authority and children, be it a formal authority or personal authority like parents, and obviously open discussion, dissemination of information in an age appropriate manner is always the best way of solving these kind of problems. Because ultimately all of us are dependent on the digital media, so we cannot actually tell them to refrain from using technology.
Do we have any other questions? Thank you so much, ma'am. Thank you, Ms. Anindita. Thank you, Ms. Shuchandra. I'd like to call upon Mrs. Minakshi Kapoor, former principal, Loreto Day School, Dharamtala, for felicitating our speaker and chairpersons. So come. इधर देखिएगा. We move on to the next presentation for the day. It's the panel discussion. The topic for the panel discussion is Role of Schools in Prevention of Adolescent Internet Addiction. I'd like to call upon the speakers for the panel discussion. Mrs. Minakshi Kapoor, former principal, Loreto Day School, Dharamtala. Ms. Rita Mukherjee, senior coordinator, Loreto Day School, Shialda. Ms. Shonali Mistry, school counselor, Julian Day School. Ms. Shruti Chatterjee, School Counselor, the Heritage School. And Dr. Praveen Kumar, HOD, Department of Psychiatry, Institute of Neurosciences, Kolkata. I'd like to call upon a moderator for the panel discussion, Dr. Raman Krishnan.
Good afternoon, everyone. And I think we are at the verge end of the day's program. It's always nice to interact with teachers and principals because I have a very close ally with school mental health. So and I have great respect for the teachers and the school counselors. So that's why I've just been called as a moderator for this program also. So hope we get some fruitful outcome of this panel discussion so that we can actually take it up for drafting into some guidelines. So which will be beneficial for the children as well as in the mental health perspective. So to start the forum for discussion and I thought like I would just like to pose your opinion on so what do you think of the impact of technology on school-going children in general? So you can just give your views and opinions.
Good afternoon, everybody. Good afternoon. My first smartphone was which I bought in 2020 because I had to teach online and I always avoided it. I don't know why. I mean, I asked myself several times, why am I doing it? I was never interested, never interested. And my children, I mean, my students, when I first started teaching, I mean, online teaching, I will have to do it, then they became my teachers. And they're such wonderful teachers. Each time I just press this button, then you start talking and we will let you know what to do, So this is the knowledge my students, I learned from them. And I always call them my teachers when technology is concerned. And again, as Dr. Raman said, I always believe in talking to the kids, and I always request in my school whenever we have parent teachers meeting and or any other problem, please be with your child, give time to your child, because if I talk in terms of technology, cyberbullying and all, since my knowledge is extremely limited, I prefer kind of, if I can learn certain things, if I feel it, I would like to share it with them, So anytime, just whenever the parents or mostly the mothers do come and complain, I always ask them, don't take it as you're complaining. Let's talk it about, that your daughter is giving more time than, not studying or always mobile, and you are absolutely lost. So I don't prefer questioning that much to the parents because they have their own ways of dealing with their own child, which I respect a lot because it's my child. I know him or her almost the best, and of course, the second best people are the teachers. So after talking to them, mostly it comes out that it's very difficult because most of them are working. And in my school, Loreto Shialda, we have a very almost a lot of mixed crowd. Like we have children around 40%, if not, no, now it's almost 48%, underprivileged kids, you know. So what happens, many of the parents may be working as daily laborers, some are working as domestic help and all. So I prefer not talking about too much of digitalizing and what is happening. I just tell them, fine, if you're working till 6 o'clock in the evening at somebody else's house, Mrs. Bose or Mrs. I mean, different surnames. So why don't you just be with your child after that? Just be with the child, and if you can talk what has happened in your school, because the mother is not okay, fine, she knows I will have to make my child they have to study, they have to finish, because mother doesn't understand what's the homework being given and all. But you know, amazingly, they are the ones who come up with that, ma'am, or you know, Miss Mukherjee, you know, last evening when I saw her, when I was talking with her about the homework and all, she wasn't that interested in her mobile. So that is something that Dr. Raman was just kept on telling us, that I find this is a type of wonderful consciousness too. So again, I would always repeat, please talk to your children, talk to your child, give them time, be with them, and why can't we make them my teacher? Yeah, of course, as Dr. Raman said, that they can kind of, you know, have more power over you. A little bit more power is not that bad, you know, as long as I can trust my child that he or she is not going to do something drastically bad that's going to be terrible for me. So can we please have trust on them? You know, I trust you. I always tell my children that I trust you more than I trust myself. So this is, I don't know, I mean, this is just my experience, you know, sharing it with you.
Yeah, we can just take that mic.
With ma'am's all the points what ma'am has said, I think parents should also, in fact, all of us should have this ability of acceptance also. There are many things going on with digital life, so we need to accept that, and we need to prepare ourselves in what can be helpful for children and what can be you know, kind of be like that we should take as a precautionary level. This should be we should have that kind of knowledge, that kind of awareness. Digital awareness is not needed only for children or parents or teachers, people who are around them. It is needed for everybody. So we have to be digitally smart to help them as children.
Good afternoon, good evening, everybody. I personally feel that technology is something very good, and that we should encourage. We all need to learn. We actually, especially our generation, we are still learners, and our teachers are our next generation, or the following generations, and our students. We need to continue to learn, and technology is actually moving with leaps and bounds. And if we don't keep pace, we will be left behind. That's what I feel. It's definitely very good, and there are so many different ways of doing things in a faster way with artificial intelligence and all that is being spoken of. I think I personally am a novice in this area, and I've got lots to learn from others. And if we don't, I feel we will be considered fossilized. And however, I also feel very scared when children don't know how to, or rather, when children misuse and overuse technology. And when children don't know the boundaries they should not cross, and that's the time when I feel they end up doing things which and put it on the social network sites or in the cyberspace, and they know what they've put will never be retrieved back. It's gone, it remains there, and it probably may be used by some third party against them. So there are a lot of fears also, and that is why I feel we need to educate ourselves and educate and make our children aware of both the good and the bad of technology. Thank you.
Just like I think you mentioned, sir, that there is parenting which was done before the digital era, and now as it is evolving, I would also say internet took on a different light in the post-pandemic era. All right, because these were children who were not even, they were children who hadn't seen their preschool. They saw it on the Google Meets or Zoom Meets. So right when they were entering their, I would say, the most enlightening part of their lives, they just got exposed to something they weren't capable of handling. Right? So I guess internet has been here for decades. Suddenly it's taken on a turn over a period of time. So as stakeholders, and I would say school being one of the most important stakeholder, we just need to understand certain things ourselves while we handhold them, while they are learning their ways and we learn ourselves, because like you rightly said, we need to unlearn a lot of things. So I guess each of us needs a little hand-holding, little support while we are navigating the balance. So I guess that will be a evolving journey throughout as we keep growing.
Yeah, so I think Dr. Raman, as you see, like 10, say 15 years back, 12, 15 years back, when we were undergoing training, we never had case like so-called such internet addiction, But now I see, like I was just discussing with colleagues some 1 or 2 months back, the same CMC Vellore, they referred me a case. This boy is having internet addiction. Please follow up with Dr. Praveen for a management. That means even child and adolescent department in institutes also, they are also seeing that there is a such separately cases of internet addiction without any other comorbidity. So that means this is true. There is nothing, it's not just like the hyped thing or no, it's clear. So when it comes to treating children, when we talk about, say, school mental health, all those things, it is not in the clinic, it is in the school. So that means, like, we as a psychiatrist or psychologist, we need to go to school and start discussing and start working with the school administration, school teachers, school counselors, how to help them at school level, not at our clinic level. That is where we start with the school mental health service. I think those sort of things is more required, so that, like, we will get from a any child's problem you can see from 3 perspective. One, from a parent perspective, another from a school principal or school administration perspective, another from a clinician perspective. So we have a onus of responsibility to see from all 3 angles and help the child. So I think this is what psychiatrist or psychologist we need to think from school mental health point of view.
Could I just add on, just like he just suggested, we realized at our school heritage, we realized that it was time to get not just pediatricians, it was time to get professionals in the field to speak to children so that they could give them an idea of what is the reality like, what could be the personal boundaries and spaces which they could decide for themselves very responsibly, and they could have a picture just for awareness. So we started doing it right after the schools became offline, and I guess it's making difference.
Thank you so much. I just wanted, because there are school counselors, because I just wanted to know whether what kind of presentations that you see, like in terms of actually, say, for example, excessive use of internet, or do you come across children coming directly and approaching you, or referred by administration people, or referred by class teachers? So do you come across children, and if so, what kind of presenting symptoms they come to you? And that is for the school counselors. And Dr. Praveen can just add on the clinical, in the clinical setup, like how do parents bring them up, or how do schools refer? Does it get any school referrals? Maybe your input on that. And on this perspective, I want, there are two students also, and I'll just ask them after this.
Sir, I would be talking about adolescents only because we are talking about adolescents at present, and due to limitation of time, we will.
Sure.
Yes, there are students who are coming to counselors, and thankfully, I give thumbs up to all school counselors that they are working so well that students are approaching them freely, and even parents are now giving them suggestions also. If you have any problem, if you are not able to discuss with parents or anybody else, you can go to school counselor. So but yes, there is little bit of hesitation also, especially when there are issues like sexting and other issues like cyberbullying or watching pornography and this kind of stuff. They come with some other issue, and then they discuss with the real issue. But yes, they are opening up, and they are, and that's why, because from since morning I'm attending the sessions, and I'm listening to a lot of psychiatrists, psychologists, clinical people. They are saying that people are coming for treatment, but when school counselors are present in school, children approach them. They are not going to children are approaching them. So counselors are giving a free space to the children that okay, you can approach a school counselor who will be keeping your things confidential, and you can openly discuss what you need to discuss and where you can draw your line. I think ma'am will agree with my point.
Any particular presentation that you come across specifically for internet addiction or these kind of cyberbullying cases?
It is actually showing in symptoms like loss of concentration,
Okay.
not being able to focus
Okay.
for a longer period,
Hmm.
feeling restless in classes. Right after they came back to classes, they couldn't sit. They were looking, I mean, the teacher, I mean, of course, you connect when you're listening, but then they themselves said, ma'am, after about 10 minutes or so, we just zone out. So initially, I had to look up to find out what is zoning out, because I didn't know what was zoning out. And now you hear that very often saying that I feel zoned out. So I literally asked one of the children to describe. And the child said, being there and suddenly disconnecting with everything. So these are things which the children themselves are talking about, unable to find why it's happening. Plus, of course, parents are approaching us, and I guess in the last 2.5 years, we've had a lot of
Difficult journey.
concerns.
Yeah.
Yes.
School absenteeism, is it a concern?
Yes.
Okay. Praveen can just, ma'am.
One of my greatest concern is like, after the pandemic, we are dealing with uh, non-sleepers. They are not sleeping well at night, and I'm very, very kind of cautious about that. And so one of my questions every day to, like, I teach class 10, 11 and 12, that is 15, 16, 17 years. Almost every day I ask them, did you sleep well last night? Did you sleep well last night? And our principal is very, very kind of, every morning we question them, are you okay with your breakfast? And are you drinking enough water? And did you see any of your friends sleeping in the classroom? And then just immediately inform us. So I don't know how much I'm going to connect this with cyber bullying or other things, but these are the concerns which to certain definitely a lot of it is we consciously, I don't say because you're using the mobile and all, I just say these are the things that we need. You need to sleep for 8 hours, you need to drink enough water, you need to have your breakfast and then come to school. If you haven't, just tell me. We have a wonderful kitchen, because we provide lunch and breakfast for almost 150 kids. We call them rainbows. They're really rainbows of our school. Any of you, if you have time, please come and meet them. They're just lovely kids, with mostly they are from the streets and don't have their parents and all. So please do come to our school. And so we just take them to the kitchen to have breakfast. This is I don't connect it with cyber thing and all that. So when all of we are talking about, then we think, okay, fine, let's try it out this way. So
But,
yeah.
but sometimes that question makes a lot of difference, ma'am. Because like, if at all you just make that initial question that like, did you sleep last night?
Yeah,
So the child may
yeah,
definitely come and open up.
yeah,
So
they do.
sometimes
They
that
do.
approach also works
Yeah,
actually.
yeah.
And
So this miss, I couldn't sleep well, because today we had two tests, So I said, fine, at least not 8 hours, at least 6 hours. Hope you have slept well. So I always prefer interacting with kids. I don't want to say the very informal way, and let's see how they come up with.
that's how it is. Yeah. Please.
Um,
Do parents come to you or bring up this issue, ma'am, directly?
Parents do approach us regarding the problems that they have had with children, especially during the COVID time and the lockdown time. And I would actually like to share with all that during the COVID period, the Loreto group of schools in Kolkata actually had something we started something called Ami Shunchi, where we had a number of psychologists and psychiatrists on a panel, and parents, young parents, especially of the junior classes, could ring up the parents and talk to the could ring up the psychiatrist and seek help for various problems that they were facing with the children. And none of us know which parent contacted which psychiatrist, so it was just provided to the parents by all the Loreto schools. But personally, as a principal during the COVID period of time, I feel the lockdown was the worst thing that could have happened to school going children. And I think that loss of 2 years, that gap of 2 years, has not only affected the academics, but it has really caused a lot of psychological, emotional upheavals. And I do know that not only me, because I used to check out with other principals also, that in practically all the schools, the principals, like we were from morning to evening, I think we were only attending to problematic cases, doing little else after the schools reopened. Also, I feel the problems became worse when everybody was at home during the lockdown. It was okay because parents were there with the children at home. The problems actually started when the parents were allowed to report back to work and the schools were still closed. So that's when I things went out of control, and we've had some really difficult cases. So it has been a concern, and I think it's going to take some time for children to go
Recover.
back to the normalcy of the pre-pandemic times.
Sure. Yeah. Because the school presentation is different, and when they come to the clinician, it's entirely different. So that's what many times, like, it's just school absenteeism. Child is repeatedly not coming because as somebody said, like, they wake up at 1 o'clock because of the nighttime play. So yeah.
Yeah. So as ma'am rightly pointed, actually one of the institute, they did a one small research on like internet addiction, and what they found is like once school started, internet addiction, the amount, it has come down. The amount of internet use has come down. So I think definitely it's a protective factor. Like, see, it's for I feel like it's across the age group. When you do not have any productive time, when your free time is more, so naturally the tendency goes, it be it for a child, adolescent, adults. So regarding symptoms, like most of the time I get referrals from the school in the form of academic decline. Child presenting with who was doing well now is not doing well. He was doing very well in class 10, say after 11 it has gone down. So after post pandemic his performance has drastically reduced. So this is a, when you inquire, then they will say that he's using internet video games, he's using PUBG game, Free Fire, so they're playing around 6 hour, 8 hour and all. And second symptom they present is like mainly aggression. Especially parents bring their kids that he's so aggressive only when he's prevented from using the mobile. So what they will do, one day they will not give mobile, next day he will become so aggressive. Sometimes even we have seen a violence to an extent that they start hitting parents. And we had to admit few of the adolescents just for the management of aggression related to internet addiction. So presenting with aggression. Another is attention issue. So you see that like the sometimes adolescents or parents bring their children with the he's not paying attention, his attention has come down, he was a good student. So I think these are the three presentation with which maybe clinically they come to us for a concerns related to internet addiction.
Sure. Thank you.
I would just like to share something else. You know, what happened after this pandemic in our school, we very consciously we let our girls play more nowadays, you know, like, you know, physically they are more active. And it's wonderful to see, you know, how much they are into the games, you know, not only after school, during if one off period they just run. We don't have enough space, you know. This is why I always feel rural kids are much more fortunate, you know, than urban kids. I always tell my students that, you know, since I come from a rural place, so I know how important to have greenery all around. You can play, you can just run around, you can go wherever, you can go to the riverside. Like, we grew up, you know. So it's not comparison, it is because we cannot provide it to the urban kids. You know, they don't know what a huge green field, how you can walk and you can just be tired. You know, once they are tired, they will sleep better. They will not go back to the mobile, you know. It doesn't happen like that.
I wish, man. Like, true. So I wish the urban kids had the opportunity and luxury of all these things. Yeah, sure. Sure. Thank you, ma'am. But just there are some students, I believe. I thought like I will just involve them to get their perspective also before we just move on to the next one. I just wanted them to say, have you come across any of your friends involved in any cyberbullying, or have you come across them like using a more hours of internet? If so, like what support were you able to provide? Because peer support is extremely important.
So, like after the pandemic,
Your name?
So I'm Yaksha Basak. After the pandemic, I had some of my friends, they who were very active sportsmen, they had suddenly become mobile game addicts. And since we stayed in a hostel, I was previously from boarding school, so over there we were not allowed with mobile phones. So suddenly when they returned from home, they had no access to mobile phones, and that time they had become extremely aggressive. Like if they were not paying attention in the class and the teacher just like told them like, hey, why you're not listening, they would get aggressive that no, I'm not doing anything, you cannot just scold me like that. So that had increased that aggression in them. And there were times when they used to be awake till almost 1 or 2 at night. They had nothing to do, they would just sit idle. But that was because of what they had gone through during the pandemic. They were playing throughout the night the mobile games, just because of that. And also regarding cyberbullying, I had this friend of mine, recently it happened with her. She had been roaming with one of her friend, and then the friend, he tried to take advantage of the situation. And like, it's normal when we go out with friends, we click a lot of pictures and we document it. So he started to threaten her ki, I'll tell your parents and all that things. But then she was lucky enough that nothing much happened, and the school authorities managed the thing. So she was
So
lucky about
do
that.
you all have some groups?
Yes, sir,
Student groups?
we do have that, sir.
Okay, so do you come across like students engaging in heated arguments and conversations?
So to be honest, during the pandemic time, I was in class 9 that time when the pandemic started. So that time we used to indulge in a lot of heated arguments. But then slowly after we used to stay in the hostel like a family. So after 2 years we were not together, and then when we returned, that time suddenly a new bond had developed. We were much more closer than ever.
Okay. Okay, that's great. So one more, thank you so much. Thank you. I think the first point, I think that was we never had even discussed or even thought about. I think that was really thankful for that actually, because the boarding school was a different experience. I think we were always talking about like day scholars. And I think he could just give us a perspective on hostler perspective, because they all went back to home and they have to come back to the same place, and they don't have access to digital technology in the hostel. It was, thank you so much. Okay. So one more thing that we observed was like there were a lot of above average students who felt that like who lost that like during the schooling absence of schooling. They get acknowledgement and reward by just being praised by the class teacher in front of a group of, because online teaching was not effective in terms of the praise and other things. So those things all like we just thought like real life scenario is much better than the digital environment teaching, and this can never replace the digital learning is one thing that we learn. I just wanted to ask you, ma'am, like how cooperative are parents when you have to actually deal with, or like if at all they have come out with some like children with the internet addiction or some excessive use of internet, because of which you say that some academic decline is happening, how parents are resolved? Because this is one condition why just we wanted to discuss this from the school perspective is this is one condition. Many times you will be calling the parents for child's issue, but this is an issue where the parents will be approaching you for help. This is you are in full control now. So otherwise many times when you call parents and say that your son is doing this, your daughter is doing this, then they'll say like, never ever, you are just unnecessarily fault finding with my child, you're just like blaming the child, you are trying to label the child, you're stigmatizing the child. You just say, go and just like meet a psychologist or a psychiatrist because your child is doing this, probably he has learning disability or learning difficulty and all that. They'll say, no, you are not teaching properly. They'll try to say, find fault with the school. But this is not the scenario. Here the scenario is they want help. They want help because I have come across a child, 11th standard student. The father approached the school. The school teacher came to his home. The teacher whom he actually has some close relationship came to his home and just brought him to the school. So I think not every time it will happen like that, but I'm just saying. So what is the role of parents in dealing with like internet addiction? So I've already highlighted, but like maybe from the school perspective, how receptive are they?
I'd just like to say that before the pandemic, we would find even children hesitant to go to the counselor, and they would all start thinking that what will my friends say? Why are you going to the counselor? What's wrong with you? And even parents were not so receptive of that idea, as you said. But during the pandemic, it all started actually. And that's when parents actually wanted help. And after the pandemic, I think parents themselves are coming and talking to us and telling that this is what I'm facing with my child. Can she go to the counselor? So we are allowing that. But I personally feel that there are two things actually I want to share. One is that before the pandemic, all of us, all adults, dissuaded the children from using the phones and the internet and what being part of various groups. And overnight, we had to eat our words. Overnight, we had to make sure that every child got a digital device to be able to be in our online classes. And with that also, they got free access to things which we didn't want them to get hooked onto. What I feel we as a society, we may have failed as parents and schools, that we fail to make the children understand that any kind of freedom has to come with responsibility. That both responsibility and freedom has to be the two sides of the same coin. The next thing that I personally have sort of observed, that if the child does not get love, compassion, acceptance, recognition at home or in school, she or he will try to find it elsewhere. And that elsewhere may not be something very pleasant. This is what I feel.
Thank you so much, ma'am. Yeah.
Sir, I agree what ma'am has said, but I want to add a little bit that because you have said that why the parents are coming after pandemic. Yes, they are coming to counselors, but still there is stigma is there somewhere. They come like recently. It happened with me only. Parent herself approached the school counselor and for internet addiction only. But when she wanted to talk first. She didn't wanted me to. Usually, I prefer to speak to the parent and the child together like that. But she wanted to speak to me first, and she covered her face to come to my my room, and while going out also she covered her face that her friend his friends should not see her that she has visited school counselor. So still that stigma is there, but to an extent, it's, I feel very happy about it, that at least parents are taking steps to approach a right person, because there are sometimes something which students might not discuss to the parents, to the teachers, to the principals, or the authority person, but they are free to speak to the counselor, or maybe the counselor has that ability to take.
But being in a school counselor, are you not at a disadvantage? Because anyways, the student knows that you will have to disclose it to the authorities, administration,
No, sir.
and it will definitely go to the parents.
Sir, at least in my school, I have that kind of advantage where I feel like that no, and it's confidential. So, and the student had asked me to keep it confidential, and parents have asked me to keep it confidential. I keep it confidential, and school administration doesn't ask me for the proper real or the single individual student. But in general, how can we address that problem? That steps can be taken, like through workshops or group sessions. We can like, if that problem is existing in all of the most of the students, then we can have a group session there. So we don't need to disclose one single student's name or parent name, that parent has said that.
But do you come across students complaining that, like, okay, I visited you, the others are actually just labeling me that I just visited a counselor?
Yes,
They are trying to just
yes,
like
sir.
isolate me.
No, sir, isolation doesn't happen. But yes, they say that, and immediately we take another step. We take a class with them, making them understand what actually counselors' work is. And actually, they are helping students only. They are kind of counselors work as a bridge kind of a thing with administrator, because students, teachers have their own responsibilities, administrators have their own responsibilities, counselors have their own responsibilities. Their work is to make a bridge between both, and both sides should work smooth way. So we take classes and we make them understand what actually counselors role is, and what they are for, and how much whatever they are discussing with us will be confidential. Even I want to share this, that one 10th class student discussed about something which I was surprised that I got to know after marriage, that part of information. So children are getting lot of information through lot of not reliable sources. So we have to keep a check. We have to understand that what kind of steps we should take to bring them in control, not just to restrict them, but to bring them into control. And they are as well understanding that what they are going through, what they are doing, they are responsible what they are doing. But the only thing is, they are not coming out of it, because that pandemic has taken that much of they have given them so much of extra time, free time, and something which you can access in very comfortably in your bed. Everything you are getting in your bed. You are getting food, you are getting TV screen time. You don't need to get up. So many parents were complain that my child is not having bath for 4 days, 5 days. But this they have got from to what they have we say not the piece to children learn from what is happening. So this is something they have learned. This is a learned behavior during post the pandemic thing.
I would just like to share a small information. I would say we have, I think all of us in schools have these orientation meets for parents before a new session begins. So this time the principal suggested that we could send out a questionnaire to get the mindset of the parents about the whole education process and what they're expecting and what their views are about things. So we had put in a question as to how far they are open to approaching counselors, because this aspect, like you said, where everybody had their own judgmental attitude about why should my child be going. So to tell you, I mean, rather, we were very surprised that out of that bunch of about 250 parents, we got a positive affirmation saying that we are okay with the child going to the counselor, and we would also like to visit the counselor if there is a concern.
That's great.
So that was a very uplifting and positive attitude, which otherwise it's like when you meet parents, like just like you said, no, this is not possible from my child. My child cannot do it.
Parents, difficulties, anything that from the
Yeah. So clinician point
clinician
of view,
perspective.
like what so when they come with their children and adolescents to me with these issues, I try to tell parents bit of in a say that like be bit more flexible about this. I have seen adolescents committing self harm, DSH attempts, just in a heated argument about internet addiction. So I just tell them parents two things. One, be flexible. Second, I'll tell them that it's not just your kid he's having this problem. It's a global issue. It is the now they are in this environment. It's not just only he is using internet excessively. Most of the kids are using it, but only thing is how much he is using. You need to be bit more monitor what he is watching and the amount of time. Some limit setting can be made. It is not like if you say you stop it, what happens is they will use it. Like cold turkey method doesn't work. Like whatever we discuss, you is it possible to make it zero, like maybe 1 week, 2 week, 1 month, after that it will again start. So it's about just setting the limit setting. You say that non-academic use max 2 hour. Once it is 2 hour, try to be more strict at that 2 hour, not from the zero point of view. So this is limit setting, and I tell all adolescent, first rule of thumb is appreciate your adolescent. As madam was saying, see, they want some place for this acknowledgement, affiliation, appreciation. We all need. Now I think in the way we are moving with this society, probably children are not getting that acknowledgement, affiliation, affection in the school and family. So maybe I think that's where the maybe there is a need to change bit of parenting. So they people say use relationships as a substitute for internet addiction. So opposite of addiction is its connection. So maybe I think those things I try to discuss with parents so that like we can come to the
It's just a little bit of sharing. We have, most of us have had about Sister Cyril. When I came in Loreto Sierra, it was 33 years back, no internet, no exposure, it's all absolutely a different world. One thing she would always tell us as the newcomers, new teachers, she would always tell us, if you see a child is very restless, bit sleepy, not paying enough attention, just bring that child and make her sit just right beside you. This was, I have never forgotten in my life. I will never forget it the rest of my life. And the second tips, I call it as tips. She told us, you don't have to do. You just, first of all, she never accepted that to sit and teach. She would always advise us to stand and roam around in the classrooms. And when you see somebody bit inattentive, just pat at her back. I'm there for you. So I think this is only possible for her. I mean, an educationist like her, like she's the Mother Teresa of education. So nothing can be better than this. Just pat at the back and say, I'm there for you. And we will share it and let us work it out together. This was another saying she would always tell us, you can't do it, you have to do it, practice it. No, not like that. Just tell her, we will work it out together. We will do it. You teach me something, let me share my knowledge with you, and let us work it out. So
sometimes this old grandmother principles will definitely work. Kindness and empathy can never replace. Kindness and empathy with children can never be replaced. say something? Sure. So as we are running out of time, I just wanted to just a final say from you, my principal and other higher administrative people. Is there any institutional policy for preventing bullying in school setting?
I think all our Loreto schools have a child protection policy, and bullying comes under that. So I think if any such cases are reported, we do take it up by talking to the victim as well as the perpetrator. And if it is of a serious nature, then we call for a child protection committee meeting. So we have a proper systematic way of dealing with it.
So I would like to say in Julian DI school also we have a health and safety committee. So we involve students also, because sometimes bullying happens subconsciously or unconsciously or unknowingly, because it starts with fun, and then it goes on in continuation. So we involve students to make aware other students that how it affects how it negatively affects on other. You might be having fun, you are laughing on them, but how that person gets affected with that word bullying only. So we involve students in that, and we have a committee also which looks after on individual cases.
I would like, we're just connecting with parents at as many levels possible. And I guess we keep saying the same thing. There is a solution. Let's work it out together. And for parents and us, I would say, let us just be there. Things will eventually, just being there will ensure that a lot of things go away on their own.
Yeah,
Sorry, sir. No, please continue.
Yeah, I think from maybe clinician point of view, so how we can prevent this internet addiction, or like how schools can help in prevention of internet addiction is, first, as a clinician, I think we need to impart bit of knowledge to the school, like, because school counselors, school teachers, I think school counselors are in a better position because they know the concept, but at the same time they need some help in how to handle these issues. We all know that yes, this is causing problem, but how to handle these issues. So conducting some kind of workshops on internet addiction in the school, addressing the involving the teachers and counselors, I think that's the best way to go ahead, to in a larger way to create awareness. If teacher knows, I think half work is done. So that is the way I think. And maybe if we can go into a very specific aspect, like how we can improve the self-esteem of the children in a group setting, how self-esteem can be improved, because it's like a protective factor. Those
Yeah.
children who have good self-esteem, have good regulation capacity, are at less risk for internet abuse or addiction. So how we can work on increasing self-esteem or self-regulation in group settings with a group of children, group of adolescents, maybe conducting such small group activities might help in prevention.
Just the first thing I always talk about is patience. The second thing is patience, and third, and of course, the final thing is patience. It's just as teachers, as administrators, as parents, I think that is the last word. And please, we will have to trust our kids. There's no other option. We will have to. I mean, nothing can be better than that. And we will work it out together.
Thank you so much, all the panelists, for that wonderful discussion and input on this. Just a final input that, like, so parent training programs, I think, like counselors can be actually trained by psychiatrists, psychologists, like that. So once you are trained in the training, so you can actually train the parents. So you can actually create workshops for the parents in the school setting. So you are all in the same league. So that is how we should actually function. And the administrators also can actually, as and when things pop up, I think like they can refine their policies and see like to create a friendly school environment so that the skills are nurtured. I think life skills training program is one thing that is already existing, if at all schools are already following. The last one is the prevention aspect. There is generally we talk about universal prevention and selective prevention. So universal is like for even the non-users. Say for example, we have not identified, maybe there should be some system to screen and identify all the children's screen, but that will be little difficult. But if selective is targeted population, say for example, out of the 30 students, your class teacher gives an input saying that this boy, his academic program is declining. So you can form a group of children who are actually going through this problem and then provide group sessions for them. So that is a selective intervention that we can adopt. The last one is whenever issues or psychological issues are being brought up to the school counselors, maybe to avoid stigmatization, you can actually sensitize the entire class. Not talking about a particular student, but you can actually say that like maybe after if today the issue has been brought up, maybe after a week or the next week, take a session from the class teacher and say that like I want to address the students on this for the 15 minutes. That's all. That 15 minutes should focus on the session which will address the primary problem. So basically you are trying to tell the other children how the person who has suffered also would have felt. So that is how we actually take it up. So with that, we will just wind up, and thank you so much for your active participation.
Thank you to our esteemed speakers on the dais. I think this presentation or the panel discussion has been rather special to us because it comprised of school teachers. School is a place we hold close to our heart for the warmth we get from teachers like you. Thank you, Dr. Raman, for moderating the session so well. I'd like to call upon Dr. Deepshikha Rai to felicitate our speakers.
It's always nice to have good teachers. I really like these two teachers. So it's really holding on to the principles of old school of thought.
I'd just like to thank Dr. Praveen for giving us this opportunity. And I'd like to thank Chandrani, who's my student, for thinking of me for this panel discussion. And I have another student sitting here, another budding psychologist, is a psychologist, Hina. So it was a pleasure being here with all of you. And I think for the little time that I've been here, I also have learned a lot. And thank you, Dr. Raman. When I entered, you were speaking and there was so much to learn from your speech. Thank you.
Thank you so much, Ms. Thank you. We'll move on to the last event for the day. It's a glitz presentation by our dear students. I'd like to call upon Shoham Pulai from NRS Medical College. Shoham. Dr. Shoham. And we'll have Dishari Chaudhary from Amity MPhil trainee. So we can carry on with Dr. Shoham's presentation first and then move on to the one by Amity. The topic for the Glitz presentation is innovative models for treatment of internet and video game addiction.
Yes, right? Yeah, study. Okay. Just a minute. Hello, good afternoon, everybody. My topic is on innovative models for the treatment of internet and video game addiction. First of all, the internet addiction, the term was used by Dr. Goldberg in 1995, and at the same time, the 6% of the population was found to be having problematic internet use by Greenfield. And since then, we have come a long way, and currently India is having 690 million of internet users. Different terminologies have been used over time, and currently DSM-5 is having the term internet gaming disorder, and ICD-11 is having the term gaming disorder. So what are the areas about most of the users like to use? That is, the online gaming is one area. Second is the social media or cyber relation. Next is the cyber sexuality and information overload or surfing. So whatever is the type of the presentation, we will be dealing with some salient features like preoccupation with internet activities, much time spent and neglecting other aspects like salience. We will be dealing with tolerance, withdrawal state, thrill seeking, and getting high. So when you're dealing with the excessive behavior, we can go for some behavioral techniques like the covert sensitization in a modified form. It can be in a digitalized fashion, like after a certain time, there can be some visual illusion that will be causing blurring of vision or the vertigo. And it can be something like this, or it can be informative video that will be depicting the harmful use of the excessive internet. The behavioral techniques or the visual illusions can be helpful for the children especially, and the cognitive techniques can be useful for older children or the adults who have little cognition themselves. The idea is that instead of the reward, if they get the repeated negative reinforcement, it may take the pleasure away. So next, when we are abstaining them from the internet use, we want to offer themselves something alternative. So we all remember these pictures from the Takeshi's castle, and when we want to shift the online use to the real life interaction, we can have some dedicated playstations. The use is that the playstations are less accessible than phone. We can have a dedicated time slot for that, and we can include in the curriculum as well, like the country Poland has included it recently. And the idea is that the regulated gaming rather than mindless engagement. And also the gamer will be able to identify that online gaming or the internet use cannot be an escape mechanism for me. Rather, I need to engage socially when he will be allowed to play in the PlayStation. And it is not restricted to the gaming only. We can promote the real life meet and greet events, and we can celebrate the people who are dealing with in the real life settings that will give them the alternative role models. The next thing that I want to talk about is making the I statement, that a person will be asked to declare his screen time at the end of the day or the kid next day in the school, also his pattern of the usage, and he will be asked to draw his own interpretation. The benefits are that, first of all, the pattern of usage will give the therapist an idea of what the person is lacking in real life for which he is using the internet. And secondly, the taking accountability of his own action, that will be empowering. As Fritz Walls told in his gestalt therapy, that awareness in itself is healing. The last thing I will be talking about is about salience, that most of the day when you are
doing things and we have nothing else to do, we tend to touch the phone. So it's sort of from impulsion to going to compulsion. Why not using the exposure and response prevention in that area in a digitalized form? Like whenever you put the phone in the therapeutic mode and you go to touch the browser, there will be some messages like this, like, do you actually did use the phone or you want to talk to somebody? That will remind you of your hobbies, or you may use the idea of helpline as well. So to summarize the things that I talked about, that visual illusion is one aspect, that is a covert sensitization. Something will be there in the screen that will cause blurring of the vision and all, that will take away the pleasure. Secondly, real life playstations and meet and greet events, also celebrating the people who are doing well in the real life, that will give the children an alternative role models. And next is owning up your own action. And last is the exposure and response prevention, or we can use the idea of helpline in this regard. So thank you all. Thank you for listening.
Thank you, Dr. Shoham. Dishari Chaudhary. Which is her thing? Introduce yourself.
Good evening, everyone present. I am Dishari Chaudhary, second year MPhil Clinical Psychology trainee from Amity University, Kolkata. Today, my topic of presentation is innovative treatment approaches for internet and video game addiction in the Indian context. So from the very morning, we have all been listening to about internet addiction and how we can counter them. So we will not study about that or know about that in detail. We'll just briefly introduce and then we'll move on to the innovative details that can actually be applied in our practical lives in the Indian context. So in recent years, the proliferation of internet and video games has woven a complex digital tapestry that now encompasses every facet of life. Like we have already discussed since the morning, that everywhere the use of digital media has been increasing, and a recent challenge, unique challenge, has been brought by internet and video game addiction. Internet and video game addiction, characterized by compulsive and excessive use of digital platforms, has emerged as a pressing concern in India's diverse and culturally rich landscape. So what does it does? It impacts academics, work performances, relationship suffers as screen time increases. Mental health concerns such as anxiety, depression, social isolation become more pronounced. And the traditional fabric of Indian society, as we know, it's more emphasized on family and community bonds. That also experiences a massive strain as individuals immerse themselves more in the online worlds. They stay more in their heads and in their phone rather than being in the present. So traditional treatment approaches, we all know that CBT, cognitive behavioral therapy, Dr. Kimberly Young, who founded the Center for Internet Addiction in 1995, developed a specialized form of cognitive behavioral therapy to treat internet addiction. Otherwise, also cognitive behavioral therapy has works the best, as the research suggests. Then there are support groups and counseling, and also medication-based interventions, which has been described in detail from the morning. So we will not elaborate on this and move on to what is the new need for the new innovative treatment models. That is the topic. So traditional approaches have limitations in addressing the complexities of addiction, and innovative models can provide more effective and personalized solutions, as they are tailor-made for each individual and more applicable in the Indian context. So what are the innovative approaches for treatment? First is the holistic wellness approach. So what does it say? It incorporates traditional Indian practices like yoga, meditation, Ayurveda to address both physical and psychological aspects of addiction. As we all know, yoga improves what? Academic performance. It brings emotional balance and self-regulation. It induces relaxation and it reduces the sympathetic nervous system activity. Thereby, it is very helpful in reducing internet addictive behavior. Next come what's community support centers. So establish centers where individuals struggling with internet addiction can receive counseling, therapy, and peer support, drawing inspiration from India's strong community values. As we know, peer groups in residential rehab centers, like we have all visited rehabilitation centers, so they can offer not only company but also the motivation and education in a non-judgmental setting that one needs for quick recovery. And finally is culturally relevant education. Like so we have to develop educational programs that emphasize the negative consequences of excessive internet use while also integrating cultural values to resonate better with the Indian population. Like if we give an example to someone by quoting the Gita, then for some a Hindu person who is very religious or spiritual or from that kind of background, so then they will understand the fact better. Like the Gita says, Shri Krishna says in Bhagavad Gita that men, in fulfilling selfish desires of a temporary burst of joy, gets addicted to desires of enjoyments, which descends into foul hell. So this is just the translation of a verse 16 from Gita. So if we quote something from Gita and they are religious or believe in God or the similar lines, then that will be easier in our Indian context. Then is digital detox centers. So organize retreats in serene locations, promoting digital detoxification through nature, mindfulness, and offline activities, taking advantage of India's diverse landscapes. So one of the finest digital detox centers in India is the Taj Wellness Retreat, which is very costly, but it is very popular in India, and it is crafted for rejuvenation of the mind, body, and spirit. So with serene locations, and they provide spa and the luxury as well as warmth, and nature retreats in the jungles and in the forest with meditating music and Buddha statue. I mean the whole environment. So the digital detox retreats are also very highly useful in the purpose. Next, telemedicine and online counseling. So leverage India's growing digital infrastructure to provide remote counseling and therapy sessions, making support accessible even in remote areas. So we have already talked in detail about this. I mean, the previous speakers have are much more knowledgeable and have told in much more detail. So I'm not going to say anything further about this. And finally, mobile apps for self-help. Develop smartphone apps that provide guidance, self-assessment tools, and exercises to help individuals manage their internet usage and develop healthier habits. So there are many mobile apps. One of the ones that I found the most useful and like the most popular ones were Your Hour. It is an app to counter smartphone addiction. So it tracks the usage time and unlock count for a week to inform like the level of addiction that you are in, like whether you are a dependent or an addict. And on the basis of that, you can assess yourself and analyze yourself, and you can decide, self-reflect that how much time you're spending each day on your screen and how you want to counter it or reduce it. Finally, parental and educational involvement. The speakers have told a lot, so I'll not tell anything more about this. Workplace interventions are also similar. The interventions like work with employers to implement policies that promote a healthy work-life balance and limit excessive internet use during working hours. So what can be the workplace interventions? They can be motivational training sessions. They can be like having the office in an open cubicle system so that everyone can interact with each other rather than being engrossed in their screens, or like more recreational activities, more fun activities should be introduced in the office, and more team spirit should be built in the office. So like that we can limit the screen time of the people working there. And finally, there is digital literacy workshops. Teach digital citizenship so that individuals use the internet responsibly and make informed decisions about their online activities and learn balance screen time habits. This have already been discussed in detail. Gamification of recovery is what it's like: creating an engaging digital platform that gamify the recovery process, rewarding individuals for achieving milestones in reducing their internet usage. So like in AA programs, Alcoholic Anonymous programs, we give after being clean for suppose a day, they get a token, and for a year they get a token, and they have to collect all these coins, and then they can be sober for about a year, for 2 years. So that is a kind of reinforcement that they're getting in the form of a token economy. So gamification also works on the similar principle. Like if you are doing something, if you are being free from the addiction for a certain amount of time, then you are getting something in return, which makes the process more fun, recovery more fun and more interesting. Then is integration of mental health services. Integrate internet addiction treatment with existing mental health services, recognizing the potential overlap with conditions like anxiety and depression. And finally, research and data collection. Conduct studies to better understand the prevalence and causes of internet addiction in India, leading to more effective and tailored treatment approaches. So obviously, if we know the etiology, then we will get the treatment approaches better. If we don't understand what is causing the problem, we will never get rid of the problem. Finally, future directions and challenges would include advancements in technology and treatment, addressing stigma and misconceptions. And conclusion, I would like to conclude by saying that addressing internet addiction in the Indian context requires a multifaceted approach that integrates traditional practices, modern technology, and community involvement altogether. By combining these innovative models, India can efficiently combat internet addiction while respecting its cultural values and diversity. Also, I would like to specially mention another therapy that I really liked, which was virtual reality therapy. That can also reduce the screen time and counter internet addiction. So on this note, I would like to thank you.
Can you just tell me some pages, some mobile apps are out there?
Right, sir.
So what do they actually do, mobile apps?
So I talked about the Your Hour app. So that is an app which tells you how much time you have spent on the screen on an even hourly basis, daily basis, monthly basis, whichever you want it to. I mean, you can check it whenever you want.
So here is a person who is actually addicted to internet.
Right.
Okay. So how do you actually motivate them to use such apps?
Yeah, that motivation is our job. That we have to do by other kind of therapies like motivational enhancement therapy or some other therapy, or building insight or psychoeducating them.
See, many times like when they come to us, like follow-up is like a little difficult, right? So
Right.
and we are just looking at something which parents themselves can implement, because they fail and then only they come to us.
Right, sir.
Okay, so like at the preventive level at the home, so can you just say some ways like how do you motivate an adolescent to actually stick on to time limit setting? Is there anything that you can think of? Yeah, just a minute. Well, let her try to answer and then we'll.
Yes, sir, sure. So first of all, if I would like to enlighten them about these apps, and even if they know about these apps and still couldn't apply them by themselves, so I would like to use some kind of reinforcement for them. Like if you use this app for this 1 week and you can show me the results, then maybe for the next session we'll do something more interesting, or I'll ask their parents to do something that they want, like take them to a movie, or I mean kind of token economy only, like 5 tokens and then you'll get a reinforcement. So 5 days if you maintain the time limit, then
See,
the 6th day.
Yeah, sometimes you can use the data limit can be a reinforcement.
Exactly,
for them.
sir,
Okay,
right.
so
Yeah,
that is how like we'll have to work with this internet
Exactly,
addiction. So this
exactly.
Taj wellness and all, you said it is costly, no?
Yes.
Right. So there are
Yeah.
various other ways like you need not go to a retreat center alone. So like you have as a family, they can go for a detox.
Exactly, sir.
Okay,
Trekking.
there are so many places, villages where there is not much of network required.
Yeah.
So and they can just
Exactly.
enjoy the scenic beauty and all this.
Right,
Generally,
sir.
Western culture, generally family, they take a detox.
Exactly, sir.
Okay, so that can be implemented in an Indian setting also. They need not go and pay to a retreat center.
No, that's not
Sure.
feasible.
Okay, thank you.
Thank you, sir.
So, sure.
So you were asking about how do we restrict the time on the phone, right? So we also have apps. I'm not able to recollect the exact name. Some promo something where it locks these apps like Instagram, WhatsApp. So we have apps where we can assess, okay, what's no need of apps, even our phones tell us which app we're using for how long. We get that information. And by downloading these apps that lock the apps that we most frequently use, that way we restrict the usage. And so that is basically forced on to, and they don't have an option there.
Something that automatically switches off after a particular period of time. So you cannot actually use it henceforth, or there is a time gap after which only you can use it. So then there is a gap given. So during that time, you are forced to just come out of the room, or you're forced to actually stay away from the mobile. So something like that only we'll have to actually think of. Oh, so Dr. Soham, can you just explain how this ERP principle works for this?
Sorry, sir.
ERP principle that you explained.
Year principle. Yeah. So it's just like the traditional ERP method only, but it's in a digital form.
I didn't just follow that.
So it's like if you put the phone in the therapeutic mode, the moment you touch the browser, instead of going to the browser, it will give you a question like this: do you actually want to use the phone, or you want to talk to somebody? Or it may direct you to your hobbies also. Or you can use the idea of helpline in this area. So it may not prevent the person from using it, but it may be a primary gateway, primary boundary before a mindless engagement.
I can understand the principle of ERP in this.
So exposure is there, but response prevention is there. I mean, this is a modified form that
They
I'm
need not.
Yeah.
They can always just this pop-up message. They need not actually yield to, right?
Yeah.
So the major disadvantage is for them, this pop-up messages and all, like they would have gone when you're into a problematic internet use.
Yeah.
This pop-up message is just a mild deterrent.
Yes, sir.
Right.
That's
So they may not even just go into that. That is
Yeah.
what I was just wondering how this would just help.
Yeah. So it's not for the treatment purpose, but I think it may act as a primary gateway only. This is one thing. And secondly, that in the initial slides that I wanted to explain
Covert
here
sensitization.
is the
this
covert
part was-
sensitization area that may actually act as a negative reinforcement. And it can be either the visual illusion or a recurrent educational video that will
Blurring.
depict the harmful uses of the internet. That's it.
So there are negative consequences also. If things are not working, the child will demand the parents to just actually find an alternative way to get whatever they want.
Yes, sir.
So that is how it is. But like anyways, good thought actually. Utilizing the psychological principles, I think you've just come out with some innovation. Good.
Yeah. Thank you, sir.
1 year ago, I made a presentation on this. So there were 6 apps actually, depending on various types of internet use. The app that you were looking for was named Flipped, FLIPD, Flip. It's sort of after a certain point of time, that may be set by the patient himself or his parents, the phone will lock itself, and it will not open till the next day. It will not open. The phone will not open. It can be open, but it will not open. Even you cannot open it with some remote second device. And there are various other apps depending upon your use. You can set your own parameters. There was one app called App Detox where you can set your own parameters. There is one Stay on Task that I think he was talking about. Yeah, but yes.
So, may I?
on the phone is everything, including camera, contact, not just social media. So it helps a lot of students who are studying online through their phone. So that helps. But relying only on apps is not the way forward as clinicians, but it is something that the client can take back home and know that they will be able to overcome this habit of depending on the
Good suggestion.
I don't think it is more in Southeast Asia. So China has come up with this new law where they have already started incorporating this into the mobile devices, so that like certain apps will just get automatically off. And they have made a draft like a national law. So although the companies or mobile companies are against this, China can so they are trying this.
So may I add just one thing, like Poland and Belgium are the two countries who have actually included the video game in their curriculum. And the idea is that instead of the mindless engagement, making the use regulated. That there will be a specific time period, there will be a PlayStation where you can use it for a specific time. That is
Thank you so much to our participants. I'd like to call our participants up on the dais, Dishari and Shoham. I would like Dr. Oshim Chatterjee and Dr. Altaf Hussain to please felicitate our participants. Thank you so much, Dr. Altaf. Thank you so much, Dr. Oshim Chatterjee. Thank you to our participants for taking part in the Glitz presentation. Thank you so much. Thank you so much to our participants for taking part in the Glitz presentation. Next time, we'd like to see more of you up here. I'd like to hand over the microphone to Dr. Shobhi Chakraborty for the vote of thanks.
Since it's customary to offer vote of thanks at the end of the show, but since there's not much people here, so it's just a customary vote of thanks. I thank all the participants, sir. You were very interested. You called me yesterday several times and you were there since morning. Thank you very much. I thank all the delegates, and I particularly thank INK administration, every people, Moushaki and everyone, Shubham here, Shushmita, Srimita, Devarati, for all your help. Thank you very much. Thank you. Have a good day.
আমাদের